Good morning.
Good morning.
Good morning.
Good morning.
All right.
Good morning, Robert. Good morning, everyone else. We're going to give it a few more minutes for people to log in.
While we're waiting for others to join, if you guys want to go ahead and put in the chat where you guys are joining us from, whether you guys are joining us from a certain organization, a certain school district, if you guys can put it in the chat, let us know where you guys are joining us from.
All right, good morning, everyone. Out of respect for your time, I'm going to go ahead and get started. I do see that we have our Hope Collaborative Board Chair, Dr. Carla Littner, here with us, who will be doing a warm welcome and introduction. I know that we'll have a few more people continuing to log in, but I do want to stay on track with time. So thank you all for joining us today. So at this time, I am gonna go ahead and turn it over to Carla.
We can't hear you, Carla. No, we still can't hear you. I think there's something wrong with your audio. It doesn't show you as muted though, so you may need to log back in then.
All right, I don't know what's going on. So if you guys could at this time, if you haven't done so already, put in the chat your name and the organization that you're with. Well, we get Carla on. I'm just going to go ahead and get started. So my name is Dariana Ortiz. I am the Program Services Administrator at Family Service Association, and also have the pleasure to oversee the Hope Collaborative, which is the Child Abuse Prevention Council for Riverside County. We are so happy to be able to resume our annual conference, although it looks a lot different this year than it has in the past, where we were able to gather in person. Another change this year is that we are doing only a half day, and obviously the major change is that we are meeting virtually. Last year we had to cancel our conference because COVID hit right on the time when we were planning it. So we're so excited to be able to be back this year. So the month of April this year, we have partnered with Riverside University Health Systems, First Five Riverside, and DPSS for the month of April National Child Abuse Awareness efforts. So it only made sense to end the month with this virtual conference and include those organizations as our presenters for the day, so that we could be able to provide a little glimpse of hope of the services that are still out there and available and how they're going about meeting the needs of our communities, even through the challenges that we encountered over the past year. Before we go on to, hopefully our chair could log in correctly and have audio to give her a few moments to speak. And while she does that, I am going to start off by providing a little summary of a roundtable discussion that we held on March 30th. So I know a lot of the individuals that are here present today attended the roundtable conversation, which was really, really good. We gathered so much information about what we've all experienced over the last year as individuals, as parents, as organization service providers. And we even actually had a couple of youth from our youth advisory councils around the county attend. So the information gathered was really important to us. So we know a lot of the information we were all pretty familiar with, and it just kind of confirmed, you know, our beliefs about what was going on. But we also gathered some new information that I feel will be important to address in the coming year or so. So I'm going to go ahead and give you a little summary of what was gathered. And then later on, you could see on the screen the agenda for the day. We are looking to end around 12:30 to give you enough time to get some lunch. So I'll give the summary now, and then the presenters will be going in more depth as to how they're addressing some of these issues in their presentations. So a lot of information was gathered in regards to how COVID impacted schools and students. I know it had so much, you know, it made it really difficult for a lot of working parents and the kids and the teachers and everyone. So some of the things noted were children left unsupervised, older siblings taking care of younger siblings, oftentimes also still needing to log into their own school. Kids just not logging in, or logging in but leaving their computer, you know, with a video off and taking naps or not paying attention or doing something else. Suicide awareness was mentioned quite a bit with the schools. Lack of technology, although this issue was resolved for the most part with providing computers to the youth, it was a big challenge in regards to having internet access, especially troublesome in rural areas. Parents and caregivers, and sometimes youth, inability to understand how to use the technology. Inadequate space for learning. Many times, many families have multiple siblings in small household, all requiring quiet space and not really having the ability to have that. Home visits. So some school districts did mention home visits for kids who raise red flags, mostly by lack of attendance. So that was a really promising effort that we heard from some of our school districts. Let's see. Okay, so some information gathered in regards to our adolescents and teens, and a lot of this was shared from the teens themselves. So this was really important information to us, was that they shared that they just don't know about child abuse. They don't know what the signs are if one of their peers was going through abuse. They don't know kind of the symptoms or information on mental health, or even resources that are available out there. They shared that the average teen doesn't know how to recognize the symptoms of abuse in peers. And even if they did, they would be scared about how to go about telling somebody or reporting on behalf of their peers. They shared that they are very unlikely to ask for help. And some of the suggestions made by these youth is that teachers need to integrate information into their class time, and teachers need to make it more known. So another thing is that they shared that there's frequently like week-long awareness weeks for mental health, for child abuse prevention, but the schools focus too much on like the fun aspects of it, to dress up on Monday a certain way, dress up a different way on Tuesday, dress up a different way on Wednesday, and don't actually emphasize or share enough information on the content that they need to be learning. So they would like to know if it's Mental Health Awareness Week, to learn about anxiety, to learn about depression, and for the schools to emphasize that information more rather than the fun parts. They also, this was a really important one. The way to reach them is to obviously make it more known, teachers bring it in the classroom, and utilize social media. Particularly let's see, other information. So that was for the adolescents. The information that came directly from Credible, they were so courageous to share their thoughts on behalf of their peers. Next, moving on, some information gathered from parents and caregivers included feeling just because of so much going on all at the same time. Significant increase in stress in both children and parents. With those impacted by job loss, there was also the added financial stressors. Parents balancing a lot of amount of mental health problems that we're seeing. Increase in domestic violence and child abuse. Children in a grief from losing a family member or ongoing fear of losing a family member. These are groups to just vent, not learn any new content or cover new materials, just vent. Of other parents that can also share their experience. One grandma who shared that babies and younger children aren't just enough, and especially since they don't have a voice. So good thing we have First Five Riverside presenting today, because I feel there is stuff going on there, and that is why we're here today. It's available how our organizations have adapted their services over the past year to make sure services have continued, because I feel like maybe our communities aren't as aware. So if we learn this, then we could go ahead and continue this information and share with the families that maybe aren't as informed. All right, so I got a message that I keep freezing, so I am sorry if you missed too much of the information I just shared. Do we have Carla available at this time?
I don't know. Can you hear me?
Yes, there you are.
Oh, good.
Yay.
Good. I'm so sorry, everyone. I've been on these calls many, many times. I've never had this happen, but I found a button on this one that unmuted me, although I think most participants are muted from the central video on this. But anyway, good morning, everyone. And thank you so much for being with us today. And let me tell you why it's really important that you are with us today. Our team just tries to function all year long, and we try to have as many collaborative partners as we can possibly have. And even our board is made up of, I don't know if you all know this, but our board is made up of representatives from Department of Education, from the sheriffs, from probation, many Department of Public Social Services. So our board has broad representation and broad collective institutional experience with child abuse and prevention and treatment. So we really have wide input in our board meetings, but the discussion is limited. We're only in a board meeting and we're trying to take next steps, and we're trying to vote on how we spend our money and where we put our resources for child abuse prevention. But days like today give us a chance to have longer discussions, to have, we can really learn from you and everyone who's here. We want to hear your input, and we want to know your ideas, and we want to know your experience, and we want to know your stories. Today gives us a longer period of time to really tap into what's happening with all of your efforts, what stymies you, what roadblocks you run into, just what experiences you've had with child abuse, prevention and treatment, and anything that will inform us and inspire us and help us to know how to make better decisions going forward with our Child Abuse Prevention Council for our county, and how we can do a better job and make better decisions going forward. We're just really glad you're here, and our speakers today are going to have, a wealth of experience and knowledge and data to back up everything that they're saying and that they can share with us. And so today is a day of enrichment for all of us. And whatever we were trying to do before COVID hit us, unfortunately, we're really going to have to accept that this happened, and that child abuse severity really was increased this year. Maybe not the number of reports because kids were more isolated, but it seems like the data is telling us from our Department of Public Social Services, and I really can't speak to this. I'm not from DPSS, but I believe that they have told us pretty clearly that the severity of cases that have come in have been, at a higher level of severity, and have resulted in removal of kids from their homes and stuff. So that's the last thing we wanted to happen, is for the severity of child abuse cases to increase. But COVID happened, and financial stresses and isolation hit families. And so we just will deal with that going forward in the best ways we can. And we're getting through COVID, it seems like now, and hopefully kids will be back into schools sooner than later, and have the wonderful teachers' eyes on them and watching them, and making sure that they're at least okay, and preventing the worst cases of child abuse. So anyway, thank you so much for being with us today. And I can't wait to learn with you. Thank you.
Thank you, Carla. All right, so we have our first speaker of the day, Libertie Miller from DPSS. She is a regional manager with Children's Services Division. She wanted a little bit of time for questions and answers, so I'm glad that we get to get her started before 9:30 to be able to allow her that time. So Libertie, her presentation is called Child Welfare During the Pandemic. So welcome, Libertie.
Thank you. And then, again, I just want to thank Hope Collaborative and everyone who helped get this event together today. I know it's not ideal, but at least we have this platform to be able to share some information and answer some questions today. So thank you for that. I'm excited to be able to share some of our statistics, some of the innovations that we've come up with over the past year, some of the things that we're hopeful in moving forward as well. And I'm used to doing discussions on Zoom. I haven't done straight presentations. So bear with me. I'm used to scanning in the room, and it's a little more difficult on this platform. So thank you again for everyone who's logged in on here and is participating today. So my primary job is to oversee our child abuse hotline. We're a 24/7 operation. And what was interesting to me last year as we moved into the pandemic was the amount of callers who, once we answered, said, "Oh, you're still open." And I guess it never occurred to me that closing children's services would be an option. But yeah, we were fully functioning throughout, and we did not close. I think like schools, we got busier, not due to the amount of calls, those decreased, which I'll go over in a couple minutes, but just trying to adjust how we operated as a division from the hotline through the back end closing cases. So it was a lot of adjustment, a lot of busyness as we were navigating. And then I think like most organizations, like most people, we thought this was going to be over a long time ago. And so having to readjust as we saw this was going to be a longer pandemic, and that there would be a continued need for using different platforms like Zoom, MS Teams. I know our division started out with one platform for virtual meetings, and we've transitioned to, I think we're on our third one now. So getting used to all those. But we've continued serving families and children in Riverside County, and it's been with the help and support of our community partners. So we appreciate all of you. So there's a lot in the news about child abuse was going to be underreported. Children were being placed at increased risk. We definitely did receive less calls. But in terms of the full picture of the impact that the past years had on kids, we just don't know yet. So I'm going to go ahead and share my screen here and go through some of these statistics. So I'm hoping that's shared. If not, if you guys can let me know. Okay, sorry, like I said, still learning all of this. So now you should be able to see it. Okay. So this first slide that I'm showing you is our total amount of referrals that we receive each month. And so the blue, we started this chart April 2019, and it goes through March 2021, so up through last month. So the blue are the pre-pandemic months, and then orange is during the pandemic. So as you can see in the beginning, we had huge drop-offs in the amount of new referrals. And just to let you know, not every call we get into the hotline results in a referral. Some people are calling just for information only, or they may be calling and we need to refer them to a different county, different state, different agency. So this is separate from our call volume, which our call volume did also drop, but these were actually the amounts of referrals that we got each month. And so you can see typically we'd get over 3,000 a month that our hotline would generate from calls. And then once the pandemic started, it decreased quite a bit. And a little over 50% to begin with. You can see here in the summer months that we made up some ground. And that's generally because in summer kids are out of school, so we're not getting those school calls and reports anyways. But as we move through the pandemic, our calls have started increasing again. New referrals started increasing again. And last month, we actually had more calls in March 2021, more referrals generated in March 2021 than we did in 2020, which is what we use for when the pandemic started. We know it was halfway through the month, but that's when we first saw a huge drop in the amount of calls and referrals that we were receiving at Children's Services. And so then I also wanted to show you guys our in-person response. So when a referral is generated, it's assigned a response priority. And so our in-person responses are either within 24 hours, which is an immediate response, or within 10 days. Other response priorities are in a secondary. So for example, if a teacher calls in reports of abuse to a student, and then say the teacher aide also calls in those same concerns, we're going to generate an NA secondary referral. If we get calls where there's some concerns, but they don't quite rise to the level of abuse or neglect, we can still generate a referral, but it will be what we call evaluated out, which just means we keep record of it, but we aren't sending someone out to investigate. We did get new calls or new types of calls, especially beginning of the pandemic. We'd get calls from concerned citizens that kids were playing outside without masks. They were intermingling with other households. We'd get calls from parents about custody disputes where one parent might be due to return the children to the other parent, but they were concerned that COVID precautions were not being taken in the other parent's home. Or in the beginning, we get calls about children not logging on to the new virtual platforms. And so those in and of themselves were not enough for us to go out and do investigations because there was not necessarily a report of harm or risk of harm. So as you can see, we did have a decrease in in-person responses, but again, as kids have returned to campus, our in-person responses have started to go up again. And in March, last month, we did receive and go out on more in-person responses than the previous year. The number of calls we receive from mandated reporters obviously decreased because mandated reporters weren't having as much access to children. So what I wanted to show on this chart was the percentage of calls from mandated reporters. So typically, it's over 70% of our calls come from mandated reporters. During the pandemic, we stayed pretty close to that. We dipped below 70% a few months, but overall, we were still getting calls percentage-wise from mandated reporters. Just like I said, they'd be different types of calls. We did have some increased calls from law enforcement after they were notified for events, and less from teachers. And so we did see that across the board, that the type of mandated reporter who was calling in varied. But again, overall, pretty consistent with the calls. And again, now that kids are back on campus, we're getting increased percentage from mandated reporters. So, sorry, I'm using two screens here. There are also changes in allegations and allegation types. So when we get calls with allegations, we code them as general neglect, severe neglect, physical abuse, sexual abuse, exploitation, sibling at-risk abused are the primary ones that we have. And so we saw actually a decrease in physical abuse allegations throughout the year, which was somewhat expected because kids aren't being seen in school as much. And like I mentioned earlier, that was something that was expressed in the media, was that abuse was going to go unreported or underreported. We can only speculate as to why there was a decrease in physical abuse allegations over the past year. Best case scenario, there wasn't abuse going on. We just don't know at this point. One thing we do know is that we as a division did change the way that we categorized physical abuse allegations. So previously, if we'd get a call, say from a teacher saying that a second grader showed up with bruising, reported that mom or dad had hit them the day before, and there are other kids in that home, other siblings, we would create physical abuse allegations as to all the children in the home. So we changed that last year. And so only the children with direct abuse allegations would be coded as physical abuse, and the siblings would be categorized as at-risk sibling abuse. So we know that contributed to somewhat of a drop in our physical abuse allegations. What we did not necessarily expect was that sexual abuse allegations actually increased. And so those, we aren't quite sure what went on there. We did change the way we categorized those also, so we expect that contributed somewhat to the increase. In that now we are generating and oftentimes going out on historical reports of sexual abuse, whereas we didn't necessarily do that before. We are including more out-of-home perpetrator sexual abuse allegations than we did previously. So that's contributed somewhat as well. I know there's been a lot of speculation that domestic violence increased during the pandemic and that impacted the families that we are serving. General neglect covers domestic violence. We don't have a separate category to measure domestic violence allegations without doing a deep dive, which has not been done. So that's the question we get a lot is, did domestic violence increase? And we just don't have those exact numbers. We did have some rather serious events of domestic violence at the beginning of the pandemic, which made the news, and I think were mentioned by Dr. Lidner earlier, but we haven't seen a huge increase in those. So moving on, despite the decrease in investigations over the past year, the total number of substantiations of allegations and the need for us to open cases and stay involved with families remained fairly consistent with the numbers pre-pandemic. So what that means is the numbers stayed the same, even though the referrals, or say the numbers of kids that we stayed involved with stayed fairly consistent, even though the number of investigations decreased. So what that indicates is that the calls we were getting, we found to be true more often than not prior to the pandemic. We don't have a complete explanation for that, but some research nationwide has shown that because we're getting those calls after something happens compared to more calls of potential risk by teachers, counselors, those types of calls, that's why those numbers stayed the same, even though our calls decreased. Stop the share. We also, knew that we would face some unprecedented challenges moving forward and needed to focus on effective and immediate practice change, as well as maintaining customer service through the pandemic. So among some of our innovations was moving the child abuse hotline off campus. This was a huge endeavor because, like I said, we're 24/7. We would have staff in office answering these calls, and we had to change our phone system basically. So there are a lot of IT challenges, some trial and error. I don't still fully understand how the system works, but we were the first county in Southern California to move offsite, which was huge for us because it allowed our staff to continue working while their children were doing at-home learning. If they needed to quarantine, but were still able to work, they could do that from home. And so our capacity to take the calls did not decrease, which was great. And also, because we were able to implement it as quickly as we did, as effectively as we did, other counties adopted our model. So that was pretty cool. Another thing we did was add the CDC screening questions to the referrals. So when someone would call in their concerns, our intake screeners would go through the CDC screening questions with them to identify if there was increased COVID risk for those families. That way the responding social workers could be better prepared. We switched to a lot of virtual visits. So for existing cases, ongoing cases, social workers would do Zoom visits or Skype visits with children, with parents, especially early on in the pandemic, to try and avoid any infection or risk of COVID spreading. For investigations, we still needed to do at least those initial contacts in person. So staff were provided with PPE gear for their safety as well. We also developed, share my screen again here. A flyer, let's try and make this full screen so hopefully you guys can see it a little better. We developed this flyer that was primarily for educational providers, but it can be used for any mandated reporters or anyone that's having virtual contact with kids. So we presented it to school personnel, to a couple different groups with RCOE and some other service providers to discuss ways that we could identify child abuse and neglect virtually. So like I said in the beginning, first people weren't sure we'd even answer the phone when they'd call in with concerns. Then they weren't sure if their concerns should be concerns, like whether kids weren't logging on, if, you know, say a 12-year-old was responsible for making sure that the younger kids got logged on, those types of things. What I generally tell people is if you have a concern, call our hotline. It's up to us to decide if it meets the level for us to go out and actually investigate. We'll ask a bunch of questions to try and determine that, but it doesn't hurt to call. So whenever you have concerns, just give us a call. But some examples of things that might come up in virtual education setting or telehealth are if during meetings in a virtual classroom therapy session, a child appears unkempt, they're like scratching, mention that they haven't been able to bathe or wash their clothes because there's no water in the house, or the parent has not responded to a teacher's attempts to see what services or assistance the family might need. That could be a reason to call in. Another child might mention that they're falling asleep during class because they're up all night because parents were fighting, and you notice there's a hole in the wall behind them that wasn't there the day before. That could indicate domestic violence. So give us a call on that. Other helpful tips are just to continue to let the students, the children, the families know that you remain a supportive, caring adult in their lives. Check in with them. You can ask questions like, hey, tell me how your day's going, or how do you feel? How are things at home? How's your family? And just kind of open-ended questions like that to start conversations. Some signs of concern could be that if they straight say they feel unsafe, or you see them in a dangerous environment, you notice a change in their demeanor where this kid used to be super outgoing and engaging and now they're withdrawn. You know, that could definitely be a concern to notify us about. If they look or behave different than they used to. If a caregiver is known to blame, belittle, berate a child, or that it doesn't appear a younger child's being properly supervised, those are things to call us on. We did get some calls where people forgot to turn off the video. And so they're actually seeing physically abusing kids. And we'd get calls from teachers on that, which had to be quite traumatic for teachers, I'm sure, to actually see it. It's one thing to have a child report that to you, to see it, or in other instances, the kid may have gone off screen and the teacher could hear the yelling and screaming in the background. You know, that's a whole other issue to deal with in terms of secondary trauma, but we would get those calls also. We got calls where children would type things in the chat asking for help and intervention. So those were some of the changes we'd see during the past year in the virtual classroom setting. And so also just some ideas on extra efforts with kids who have a history of abuse or neglect, or you're aware of previous substance abuse issues, if you're aware of mental health issues with children, you know, just paying that extra attention, making sure to check in with them a little more during the pandemic was something that we recommended. I know there's also been a lot in the press about suicide, substance abuse during the pandemic. Riverside County was actually the only county in Southern California that did not have an increase in youth suicides during the pandemic. You know, one is still too many, but we did not see an overall increase. What we did see was a shift in age. So we started seeing younger kids like 9 to 11 making attempts at suicide. Unfortunately, some were successful. So that was a little shift in the demographics, but overall the numbers did not increase. Whereas with substance abuse, definitely we've had increases in that, especially with fentanyl overdoses. That's been well documented in the local press as well. And we've also had to make adjustments for our staff who are responding to those referrals so that their risk of exposure to fentanyl is reduced also as they enter homes. So, another innovation that we had to do was implement virtual services. Obviously, you couldn't just drive to the counselor's office. You can have group parenting classes or anger management, etc. So being able to do the virtual services was a huge help, so that even though a lot of families did kind of take a step back in moving forward towards reunification, towards getting cases closed, at least we were able to implement virtual services to try and mitigate some of that and help the families with that. So, and that's actually something that helped us give us hope for the future. Because as we're now moving back into in-person service provision, we will continue with virtual services. This will allow clients who have typically been in service deserts or lack transportation to still engage in services, and actually makes it easier for them. It may make it easier for their schedule if they're working, where they could do an after hours class that may not have been available in person. And so we're just excited that we're able to continue that. Historically, we've had to struggle to incorporate transportation services into our service contracts. And a lot of the families we deal with, they don't have dependable or consistent transportation. And there's so many different bus systems within the county that it's hard to navigate, especially if you're going from one city to another. Oftentimes you have to change from like Riverside Transit to, say, the Pass Transit Agency, and it just can take 3 hours to go, 10 miles to your parenting class. So we're really looking forward to continuing these virtual services and hoping that it's going to have a positive impact on these families. Another thing that I'm really super excited about is what we call our Red Team. We started researching this the end of 2019, and then over the past year, we're able to develop it and actually implement it in January of this year. And for me, like I said, this is one of our more exciting innovations over the last year. So what RED stands for is Review, Evaluate, Direct. And there are models throughout the country that have shown real significance in helping reduce maltreatment for kids, as well as any reduce their risk of current harm as well. So what the red team does is they are assigned those evaluated out referrals. So when I was talking about in-person response previously, we would not go out on referrals that did not need an investigation. And so now we're able to do that. We have a team of social workers that on certain referrals, which I'll go through with you here, they can go out and help the families. And so the allegations, like I said, do not meet the statutory definitions of abuse or neglect. The family has to reside in Riverside County, and the concerns should be able to be addressed through local community services, or like I was saying, virtual services. The family has to be willing to utilize these services on a voluntary basis. There's no court involvement in this program. So some of the things that we go out on and try to provide services for our family law or custody concerns. So where those parents they're not able to communicate effectively with each other, always fighting, we can provide services to them for communication, for successful co-parenting. Whereas previously, that type of referral where it's only parents aren't getting along, but there's no direct harm to kids, we wouldn't do an investigation on. School attendance, truancy, delinquency. For older kids, truancy alone is not typically something we'll go out and investigate. But the red team can go out, meet with the family, find out why are these kids not going to school? What are the issues with attendance? What can we put in place to help them get to school? Multiple history alerts. So where we get multiple calls on a family over the years, it may not rise to the level of abuse and neglect, but there's enough concern that people keep calling in. So are there some services we can put in place to help them? Low risk substance abuse, nonviolent domestic violence. So anything that's not physical. So parents yelling, things like that, not if they're throwing things, not if there's physical violence involved, that we would still investigate. Incorrigible youth, so kids who are running away, kids who are bullying others, or maybe being the victim of bullying. Typically, we would see that as more of a school issue and not something that we would need to investigate. But with the red team, we can go out and try to hook the family up with some services. Homelessness. Homelessness in and of itself is not a child neglect or abuse issue. So if kids are able to get showers at grandma's, but they're sleeping in mom's car, but they're eating, that typically wouldn't have been something that we'd go out and investigate. But now we can send social workers out to try and set this family up and get them hooked up with self-sufficiency to get some homelessness services, get them some stable housing. And along with that is food insecurity, and just among some other things that we can go out on. So again, this is something we're very excited about. And so these social workers, they first try to call the family. You know, when we get an investigation, we try to do unannounced visits, kind of catch the family off guard. In this program, we don't want to be intrusive. We want to collaborate. And so the social worker will first try to call the family and avoid any unannounced knocks on the door, because that's scary for a family, especially during pandemic, for new reasons. We want to be viewed, again, as helpful, not intrusive. And so once the social worker does make contact, then they are starting to do home visits now. Previously, they were doing it just virtually, but now they'll make appointments with the family for what's convenient with the family, to meet with them, to conduct a needs assessment in an effort to identify stressors and assist the family with navigating through community resources. They'll provide service referrals and resources to families based on that needs assessment, and ensure the family is connected with service providers and refer to additional services as issues come up. Our goal with this program is to end our involvement with these families within 2 weeks. Because again, we're not doing an investigation. We're not opening a case. We want to do a warm handoff to service providers. And so hopefully that can be accomplished within 2 weeks. And then based on evidence from other agencies that have utilized this model, it's expected that the RED team will help reduce the risk of future maltreatment and recidivism, which is one of our system improvement plan goals. So we're looking forward to seeing how this works, if there are things we need to change along the way or improve, different things like that. And the feedback that we've received from families who have engaged in this program so far is that they're receptive and they're appreciative. We've even gotten emails after we've closed out saying, just thank you for coming and taking the time to explain things to me and making sure that we were hooked up with free and affordable services. And again, the team does not investigate. So the goal is to prevent future investigations. If a family is resistant, if they say no thanks, if they don't answer the door, they don't answer the phone, we don't then open an investigation. Again, these are referrals that there's not enough information in them to lead us to an investigation. So not participating in services through this program is not enough for us to say, well, fine, then we're gonna open an investigation. So if they're not receptive, we just walk away and close it. Again, because we want to be seen as helpful, not as intrusive in this program. So our team is currently reaching out to schools to conduct presentations. They plan to reach out to other service providers in the near future. So if you guys are interested in them doing presentation for you to talk about the program, to partner with them, because we're always looking to expand our collection of service providers. We can use non-traditional service providers because we don't have to have a contract for this program with a provider because we're not going to be involved with the family. So if that's something you're interested in, let us know. And with that, here's my contact information. If you want any more information on the RED team or the virtual identification of child abuse and neglect, you can go ahead and email me and go ahead and see if you guys have any questions.
Well, thank you for that, Liberty. There was two things that you mentioned that gave me the chills and made me teary-eyed, which was the suicide age decreasing and some of those being successful, as well as the teachers observing some of the abuse occurring, you know, seeing it through the screen. That like really hit me. It was really impactful. So what you guys do is just incredible. I love the ending part with this like new approach that you're taking for the less severe cases. So thank you so much. I think this was very helpful. I know that you got a lot of comments. You got a few comments in the chat box in regards to people finding this information very valuable.
And I'll go ahead and type my contact information in the chat box. So you guys can go back to it also.
So I'm going to go ahead and read out the questions to you. So the first one we have is from April Jones. Let's see. Okay, what type of calls typically result in follow-up or investigation?
That's pretty broad. So any report of direct harm to a child. So whether it's physical abuse where a child has been hit, whether or not there's injuries related to it. If there's visible injuries, we're going to go out right away on it. If there's not, it could be made into a 10-day response. But yeah, so physical abuse, definitely. Sexual abuse we'll go out on. We do get calls about, you know, younger kids, like say kindergarten, first grade, that may be involved in like sexual exploration, if you will, where it's not one child victimizing the other. Those we wouldn't necessarily go out on because there's no report of a parent not being protective. And generally those are calls we get from schools, and the schools let the parents know this is going on. We will go out on calls if children are not being fed, if they're lacking resources, like utilities, things that are just not physically safe in the home. If a home is just in deplorable condition, drug use, well, I should say drug use related to child maltreatment. So, we'll get calls saying a parent is smoking marijuana regularly. Well, if the children have another caregiver or they're not exposed to the secondhand smoke or around the drugs, we may not go out on those. But if there is a link to harm to the children, then definitely we're going to go out. So it's just so broad. I hope that answered the question of what we would go out on. Again, if you have any doubts, just give us a call and we'll kind of talk you through the situation, and then we make the determination as to whether it's something we go out on or not.
Thank you. The next question is from Xochitl Perez. And I want to say that this was in reference to like that red, the red items that you noted, but correct me, Xochitl, if it's not that. She wrote, where can we find more info on this program for our SARB process? And also our school-based social workers. Is this something we can directly tie with school district functions?
Yes. So again, I'll put my information for contact in the chat. SARB is a big thing that we would probably go and be involved with, where we might not do an investigation typically. And yeah, schools is going to be one of our major partners on this is our plan. So again, we just started in January, so we're still rolling out. They're just finishing up the presentations to our staff countywide within the regions so that they're aware, and then starting to reach out to the schools as well. So if you have not been contacted by someone from our team, you can contact me and we'll get it set up for you.
Perfect. Next question from Lydia Valenzuela. Can we make a direct referral to the red team, or do we go through the CPS line?
So it's through the CPS line. So how it works is the supervisors who review the referrals, the calls that come in, will then submit those that they think are appropriate for the red team. And so if you're calling something in and you think it might be red team appropriate, now that you know about it, you can mention that to the intake screener, and then they can forward that on to the team. If there's information in there that we need to do an investigation, we'll still do the investigation instead of the red team. But again, we'll figure that out if that's needed, or if it can just go for the early intervention services instead.
All right, thank you very much. I want to say that you answered this one a little bit, but let's see. Do you investigate emotional or verbal abuse cases?
Yeah, emotional abuse, we do. And so verbal abuse can tie into that. There's a much higher burden of proof, if you will, for emotional abuse, because you can't always see that. But yes, we do take those. And generally, it's been rare that we've opened a case where there's only been emotional abuse. Generally, there's going to be some kind of general neglect and at times physical abuse associated with that. So yes.
Okay. This is the last question before we move on to the next one. I know that she will be putting her contact information on here. Oh, thank you, Noemi, for including her email here. So if you have any follow-up questions or want some of this information, I know that we got a couple inquiries that they want you to go present at their organization. So we got some of those, so be prepared for those requests. And the last one is, if a call gets directed to the red team, will the school still receive any type of notification that someone went out versus being closed?
Yes. So we will indicate on those mandated reporter responses that the red team went out. Also, the red team's going to try and contact you if you're the reporting party. to get some more information. And the ones that they have gone out on, that they've had that follow-up communication, whether it's just the counselor or the school personnel, has been positive. And we've heard that you guys are very appreciative in hearing that, okay, even though we didn't open a case, this is what was put in place for this family. 'Cause I imagine it's difficult calling something in and then never knowing what happened, other than you keep seeing this kid and you're not aware of anything changing, and how frustrating that can be. So the mandated reporter letters are changing if red team's involved, but you still should be getting contacted by the social worker who's going out to meet with the family.
Well, thank you so much. This
Thank
was
you.
so informative. It's really interesting to see what goes on behind the scenes and all that you do. I know this was super informational to all of us. So I'll give you a virtual round of applause.
Thanks. And thank you guys. And thanks again for setting this up, and for everyone who's participating and regularly participates with Hope Collaborative. I know Children's Services is just so appreciative of all your efforts.
Thank you. Great presentation. All right. So if you do have any follow-up questions for her, please type them in the chat. And if anything, we could probably reach out afterwards and then get back to you with the responses. So next up, we have Dr. Mark Massi. I hope I said that correctly. I know that he was a panelist in one of our previous conferences. So this time we get to give him a little bit more time, which I'm really excited about. So Dr. Mark Massi is a forensic pediatrician with Riverside University Health System Children's Assessment Center. And his presentation is Child Protection in a Time of Pandemic. So please welcome Dr. Mark Massi.
Hi, good morning, everyone, and thank you for that introduction. I have a presentation that I'd like to share. And hopefully you can see that. Okay, so I'm going to talk about our experience over the past year.
I'm sorry to interrupt you. Could you put this in like presentation mode so it could
Oh,
be a
sorry.
little larger on the screen?
Is that in presentation mode now?
Yes, much better.
Okay.
Thank you.
Oh, it looks like some of my some of the graphics are missing. Hopefully that isn't a problem for the rest of the talk. But I wanted to talk about our experience during the past year with the pandemic here at the Riverside County Child Assessment Team. And so what I would like to talk about today are just explaining what RCAT is and what we do, and talk about some of the trends and the patient care here at RCAT, and how we've made adjustments during the pandemic and how we support families in the course of our work. So who are we? Well, RCAT represents a collaboration between a number of organizations, the Riverside University Health System, both the medical center and behavioral health are major contributors to this, as well as the DPSS, Children's Services Division, the District Attorney's Office, the Riverside County Sheriff's Department, and other local law enforcement, and various victim advocacy organizations here in the county. And this partnership provides a multidisciplinary team approach or response to child maltreatment for our county. We are accredited by the National Children's Alliance as a children's advocacy center. The other CAC in our county is the Barbara Sinatra Children's Center, and they provide services to the eastern part of our county. And they're in the process, if they have not already done so, they're in the process of getting accreditation as well. At RCAT, we're comprised of a program manager, Crystal Shackelford, who some of you may have worked with. We have 2 full-time and 1 part-time board certified child abuse pediatrician. We have 2 mental health therapists, 2 medical assistants, a vocational nurse. We have a social services supervisor, a family advocate who is also a social worker here at the clinic. We have 3 forensic interviewers, an office assistant, and we also have social work interns from local colleges and universities who do rotations with our clinic as part of their education. So we're located at the RUHS Medical Center here in Moreno Valley, and we also conduct forensic interviews at the Inland Empire Project Kids in Corona, California. So what do we do? Well, we provide outpatient forensic medical evaluation of children referred to us by Child Protective Services and law enforcement, including mental health crisis intervention and referrals. So as was mentioned earlier, some of the reports to the county children's services have gone down. And so as a result of that, the referrals of children to our clinic have also gone down, and I'll show some of those statistics in a few minutes. We provide 24-hour on-call service and inpatient and emergency department consultation for suspected child maltreatment victims here at the hospital. We coordinate care and provide follow-up for the minors that are seen by our forensic nurse examiners during non-business hours through their sexual assault and forensic evaluation clinic. So the SAFE, or sexual assault forensic evaluation nurses, they also see adult victims of domestic violence and sexual assault, but the minors are referred to us through the SAFE clinic so that we can provide follow-up medical care if needed, and to ensure that the advocacy portion of the services we provide are linked up to that patient. And we try to make sure that none of those patients fall through the cracks in terms of making sure that they receive the services that they deserve. And we also review, the physicians that is, we also review the emergency department admissions for childhood injuries, and these are identified by our forensic nurse examiners each day, and some of those children may need to be followed up by RCAT or have referrals to children's services and law enforcement generated if for some reason that wasn't done during their emergency department stay. Okay, so as part of their ongoing medical education, recently graduated medical students will also sometimes rotate through our clinic. So we provide supervision and education to those residents who choose to do an elective with child abuse pediatrics. We give lectures to medical students and residents. We participate in educational programs for children's services, law enforcement, district attorney's office, and Hope Collaborative. And we provide expert testimony in legal proceedings. So because I knew that someone from Children's Services was going to be presenting some of the data for Riverside County, I thought I would take a look at child help data. So this is the National Child Abuse Hotline data. And just to put things in perspective, nationally, there was actually an increase in the calls to child help during 2020. But they also have the capability of receiving text and email referrals, and they saw a dramatic increase in the number of texts to the National Child Abuse Hotline. Those calls or texts may not necessarily result in investigations, but there was increased activity at the national level, and this was just comparing the March 1st through 24th periods between 2019 and 2020. So this is just a graphic of that, and here is the 2020 data. As you can see, there was an overall increase compared to 2019, but the most dramatic increase, although it still comprises a small number in terms of the total contacts to child help, the text calls or the text contacts to child help increased dramatically. This is unpublished data, so I would ask that it not be shared at this point until this article does get published, but this was looking at telephone referrals to child help. And you can see that there was a dramatic decrease between March the 4th and April 19th in 2020 compared to 2019, which is in green here. But then by 2 weeks later, the number of calls seemed to recover. And this data only goes through the first 25 weeks of last year. So the complete picture is still being formed with respect to how many calls may have been received and whether in the end things seem to normalize or whether this increase persisted. So here are the text referrals, and you can see that in general, they were on the order of about 70 per week, and then after March 4th, things increased dramatically. So, these are the text referrals to the Child Help Hotline. So how did patient care get affected at RCAT during this past year? Well, we had to implement some changes to our patient flow. The inpatient pediatric intensive care unit and general pediatric ward in the hospital were actually closed in the winter months. So some of those children were being diverted to Loma Linda, for example, or possibly Children's Hospital of Orange County or Rady's Children's. So we don't know about how those numbers would have affected or would have been incorporated into our statistics if they actually stayed at our hospital. So those units were actually closed in the winter months of 2020. So when there was an allegation of sexual abuse, whether it was acute or a remote sexual assault, those interviews pretty much still remain timely, meaning when we got the calls, we were able to get those patients in pretty quickly for their interviews. But if there were delayed disclosures, sometimes we had to defer their exams to a later time. And one of the reasons for that is because we only wanted to have one family unit at the center at one time to minimize the commingling between different family groups. And we also limited the number of visitors that can be present in the clinic to just one caregiver for the child or group of children. And so our staff, as with other medical facilities, we increased the use of personal protective equipment. And in general, though, our approach to families was unchanged in terms of they were still provided with linkages to advocacy and mental health, and so that aspect of how we did things really didn't change throughout the year. So these are some of the statistics on a year-by-year basis. and in green is 2019, and you could see that 2020 compared to 2019, the number of children receiving services at RCAT did decrease, with the exception of the February to March period. So this is when some of the lockdowns and mitigation measures went into effect, and you can see that there was a decrease between March and May in terms of the number of children receiving services at RCAT. Here is the first few months of 2021 in the dark blue, and we seem to be going up to the 2019 levels, and we'll have to see if that trend remains in place or if we see another decrease like we did last year. So what types of abuse were alleged for the patients we saw? So these, some patients may have had more than one, may have fallen into more than one abuse category. For example, physical abuse and neglect often goes together, or witness to violence and neglect will often go together. But most of our patients were sexual abuse patients, and a reason for that is a lot of these cases may go to a forensic interview, but then there is no disclosure during the actual forensic interview. So some of those patients may not go on to get medical exams. So the sexual abuse component in RCAT, it tends to be the greatest number of patients that we see, followed by physical abuse and neglect. In terms of the types of services we provided, we did see a slight decrease in the number of medical exams that were performed, whereas 2018 and 2019 were comparable. There was a decrease in the number of medical exams done at the center last year. The in-house counseling also decreased, as well as the referrals to outside agencies for counseling. And whereas the forensic interviews were pretty consistent or comparable in 2018 and 2019, there was a drop in 2020. So here are the medical exams on a year-to-year basis per month. And you can see that overall our numbers were consistently lower throughout the year, although we may be seeing some catch up as we approach December, and we came into the year 2021. We may be seeing a recovery in terms of the number of exams that we're doing, and we'll have to see if that trend continues. Here are the forensic interviews, with the exception of March 2020. There were fewer forensic interviews last year compared to 2019, and so far this year we're seeing comparable numbers to 2020, and we'll have to see if this trend also continues. And so those are the contacts that we've had here at RCAT. And so what are some of the things that we're doing to support families? So one of the major services that we provide are counseling services and referral to mental health and behavioral services. And 227 children last year received at least one counseling session here at the center. And this comprised crisis intervention. So if a child was having a crisis as a result of the maltreatment they experienced, we did intervene in those cases. with mental health services. Our clinicians or therapists also provided mental health assessments, and 9 children received actual ongoing trauma-focused cognitive and behavioral therapy. So these were children that were seen by our therapist on an ongoing basis for programs of about 12 to 16 weeks. And they came here for intensive sessions with our therapist. And many of those have graduated from that program. We have a new therapist now. So we're back to 2 full-time therapists, and she's starting to enroll patients for an intensive program as well. So we're expecting to see, more of those services continue throughout 2021. I may be speaking too quickly because I think I'm nearing the end of my talk already. So what do we do to support families directly? So we provided services to 420 caregivers last year as well. And this is one of the roles of our family advocate here at the center, and our social work interns also were doing some of this work. And so one of the major things that we do is a needs assessment for each family. And that could be anything from, the counseling or mental health to, domestic violence advocacy to, shelter or food security issues. And so we do a needs assessment for each family that comes here, and we ask them to complete a survey of the needs that they may require, and we try to link them up with the appropriate agencies throughout the county. We provide them with information about victims' rights and victim services for which they may be eligible. So this is not just for the child victim, but the family, the immediate family is also eligible for some of these victim rights services. And then, like I mentioned, we do provide the referrals to advocacy, victim of crime services, counseling, community resources, and public assistance, whether that's help with childcare, food security, housing, or other aid. So nationally, there seemed to be an increase in the number of contacts to child help in 2020 compared to 2019. While telephone contacts decreased in that initial period from March 4th to April 9th, the text contacts remained high in 2020 compared to 2019 throughout this same period. In 2020, RCAT did see declines in all areas of service provided compared to 2019. And while forensic interview and medical treatment or exam contacts were lower, the numbers seemed to be recovering by December of last year. And all of the children and families who did come to the center continued to receive the full range of services that we provide. So I wanted to comment on some of the discussion earlier about the decrease in the referrals to our children's services, and there are starting to be some medical literature published on this, and one of the initial papers that I saw talked about the fact that there was actually a decline in the number of serious child physical abuse cases in 2020, and they theorized about what the reasons might be for that, and in particular they were comparing to the recession in 2008, because after 2008, there was about a lag of 1 year. By 2009, there was a dramatic increase in the number of serious physical abuse cases. And that didn't seem to happen with the recession that occurred with the pandemic. And they had some theories about why that may have happened. And one of them had to do with the fact that the federal government provided, financial assistance to families through, legislation in Congress. And so that may have relieved some of the stresses that the families may have been experiencing. The other thing is that there was an increase in social services provided during this time, and compared to the recession in 2008. So the availability of ancillary services and the financial support they theorized may have actually contributed to the lower numbers in serious physical abuse cases. But here at RCAT, I can't say that I've noticed a significant increase in the serious physical abuse. And so we'll have to continue to look at some of that data. But I have not seen the same dramatic increase in serious physical abuse last year that we did in 2008 and 2009 with the last recession. So hopefully that holds up to be true for the rest of the year as they continue to analyze the data. So that's the end. I think I went too fast, but I have a lot of time for questions now.
All right, thank you, Dr. Massi. That was really great information. I was especially impressed by the information you shared about the comprehensive team that makes up RCAT. I know our board member of our Hope Collaborative, AJ Oseguera, has nothing but really great things to share about you all the time. I know that the work that you do is not easy. And the things that you probably encounter is, pretty severe. So thank you so much for what you do all the time. We do have a couple of minutes for questions. If anyone has any, let me see the chat. Okay, so we have one saying that they're good to hear the additional resources and support that you provide to our families. From Sochi, I thank you so much. Some encouraging info and glad to know more therapeutic care is being offered. Do we have any questions for Dr. Massi?
Either I did so well that I covered everything that people wanted to know, or people were asleep.
I don't think so. We have Carla, who has her hand up. You're on mute.
Okay, good. Can you hear me?
Yes.
Okay, thanks. Thank you so much, Dr. Massi. And boy, in my introductory little comments, I said that we had been told earlier on in the pandemic that there weren't as many reports, but that the severity of those reports were, more significant. So, but hearing the Libertie's comments and yours, boy, is that encouraging to hear that maybe the governmental response and the assistance to families or whatever, maybe that didn't bear out throughout the whole time period of severe COVID. And that's just so encouraging to hear. And it's just great to know that DPSS and our, county's hospital response has been so helpful to these families and these kids.
Yes, I'm sure there will be more published on this topic in the next year or two. Hindsight is needed to make any valid comparisons, but it seems like, at least in my experience and the experience of the authors of that one publication, the serious physical abuse didn't seem to materialize as some people feared.
Okay, that's helpful insight. I wouldn't have understood even a possible reason for that. So that's just good insight. Thank you.
You're welcome.
Right, we have a question from Mike Barney in the chat that says, from your perspective, what do you need from educators to support your work?
Well, educators, as you know, are a significant contributor to the reports that Children's Services, and there was some discussion earlier about teachers and school personnel actually witnessing abuse through Zoom calls during school hours, and we did have a few cases of that here at the center. But I just want to encourage you to continue, considering child abuse in the children that you serve, and to continue to make those referrals, and this way that we can do the full assessment and assess their injuries and get them the services that they need. But I would just say to continue doing what you're doing. Yeah.
Thank you. Any last questions? Otherwise, I want to thank you so much for joining us today, taking time out of your very busy schedule.
Oh, you're welcome.
So thank you so much. So at this point, I am going to give you guys a 10-minute break. So if you guys want to give Dr. Massi a virtual round of applause.
The applause is deafening. Thank you.
Thank you so much.
You're welcome.
All right, so I'm gonna ask that you guys return. It's 10:36. If you could return back at 10:46, so we can resume with the next presentation.
What's up? Yes, sir.
And then you explain for food trapping the paragraph. If you want to write that
Yeah.
on the
Patient says food traps all over. Gingival
Stephen, you're
grafting.
unmuted.
All right, I want to welcome everyone all back. All right, let me make sure we have Katie Gilbertson here with us. There
I'm
she is. Okay. All right, so at this time, I am gonna go ahead and introduce our next speaker, Katie Gilbertson, who is the Executive Director of Safe Family Justice Center. And her presentation is Hope Heals Trauma. So please welcome Katie.
okay, so I'm going to go ahead and share my screen. Thank you so much for having me here today. I was really excited to be able to join you all and have this discussion with you about what we've been doing and how we've been collaborating. So as we kind of go forward, I just want to share, my name is Katie Gilbertson. I'm the Executive Director of the Safe Family Justice Centers. And if you're not aware of what the Family Justice Center is, we are a domestic violence nonprofit that operates here in Riverside County, and we provide services to victims of abuse, primarily domestic violence, but we also serve victims of child abuse, elder abuse, human trafficking, and such. And part of our model is to work under the Family Justice Center framework, which allows for community partners in the community to join us on site in our buildings. And the entire purpose is to help people who come and seek help from us to not have to retell their story and drive all over the county multiple times to get what they need. So I'm going to talk to you today a little bit about what we've done as an agency and what the impact was on our partners. And we'll go through a little bit more about where sort of we've developed as the year has gone on. So before I do that, though, I just want to take a moment to talk about the risk factors that we see as it relates to child abuse. And this was a good review for us because when the pandemic first set out, we knew that there was going to be a crisis that we were getting ready to work. And so when I was reviewing some of the risk factors that we see related to child abuse, I found that these were things that were really identifiable to me as a person, and I think to our community as a whole now more than ever, because when you look at some of these risk factors, these are some of the factors that we see that people are experiencing just as a result of the pandemic alone. And so looking forward at that, it just puts us in a position to where we know the element of child abuse in our community and in our nation is something that's really at risk. The other major important thing that I think was important to recall back to is that when we're looking at the elements of child abuse, our thought is that child abusers are, the scary person in the neighborhood, the person who's not welcome, or we have an idea that these individuals are monsters. But what we forget to realize is that the nature of child abuse is at home. And it's in our community, and it's in places where we have a presumption of safety occurring. And so it's important to have the reminder that the people that we're most concerned about as it relates to harming our children are the people who are genuinely in our lives and are at home. So we look at parents, caregivers, family members, neighbors, friends, and people in unique positions of power. That's something that we see quite often in the county and in the nation, where we hear about abuse cases that occur in situations where we think our kids should be safe and they weren't, because someone in a position of power has assaulted or hurt a child. And so the reminder that we went into in the onset of the pandemic is that we had to have some real dialogue and discussion with our staff about the reminder of having to be vigilant and be in a position to look for the indicators of child abuse. So what we know about child abuse is that it's hidden in plain sight. And what that means is that we could see a child on any given day and look at them and see them and have no idea that, based off of how that person looks, that they might be dealing with a situation of abuse. And what that requires of us is that it's something that we go and look for. We're all here today to be educated and to learn about how child abuse has progressed in the issue of the pandemic. And so that requires for us to know that the signs are going to be very subtle, and it's up to us to look for them and to know what to do with them. And so when we think about child abuse cases that we've seen in the media and the news, I think we all come to the realization where we look at the child in the pictures that are shown and we think, how is this what an abused child looks like? Is this a situation that could have been prevented? Was there something that I should look for? And I think our last and final question is always going to be, what would I do to prevent that from happening? And so it's really important that we be insightful and introspective about the realities of child abuse, more than likely being at home and in our community. So when we looked at sort of what the impact was with COVID-19 and our cases, we had a couple of things that came into play. As responders to local crisis situations, part of our work with crime victims is to be ready for the things that are unexpected and that are inevitable. But we had a couple of wrenches sort of thrown in that process when we began assisting victims of crime. The first and foremost, major issue that we had was the need to isolate. We entered a world where it was no longer safe to have close, contact in proximity with somebody that we didn't know. And that was the very nature of our business. Our service model for helping victims of crime required that we met with them in person, and that we had the opportunity to talk to them and allow for them to properly share what they've experienced and what they've gone through. And that was something that was taken away, and it was very difficult for people to, understand, why can't I come to your building? We did not close during the time of the pandemic. We did have to temporarily modify our hours and close our building for a small period of time. But at the end of the day, we never left the building, and I always had staff that were present on site because we recognized the nature of the danger that our people were in. The other issue that came into play for us is that, resources in Riverside County are very limited for victims of abuse. And they became even more limited when the rest of the community had been placed in a position where their survival was placed at risk. We had a moratorium on evictions. We dealt with the issue of EDD fraud, which was very significant. It's the largest fraud case that I think California has ever seen. And that really placed some serious impact on, or some stress on, the families that we worked with in the community. In addition to that, we saw a lot of issues related to social justice disparities as time went on. And when people in our community see that there are still issues of racism and inequality and the different things that go into play, that affects their ability to want to reach out for services, especially when they're in a very significant and vulnerable place. And so these were all of the things that we had at stake when we were preparing for how we would respond to the pandemic. And when we look at our children, we all know that school and work and the daily activities that they were able to tap into all went away. And so what we relied on as a system to keep track of these people and to make sure that they were safe also went away for us. And so it really required for us to pivot. And I'm going to talk a little bit more about that. I think the last thing that I want to acknowledge about the difficulty that we've had with COVID, and I think that this is something that everybody shares a sentiment to, is that we had a situation where, as providers in our public field, we're the helpers, and in some regard our ability to help became not so safe for us as individuals and professionals in the field. And so it presented a very stressful time for people to navigate crisis in the world and then also crisis in their work. And in addition to that, being able to determine if the decisions that they were going to make to go out and help the community would have any adverse risks to their personal well-being. And so those are all things we had to look at as a community and as providers as a whole to try and make sure that not only we assisted the public and we continued to be there for them, but that we also took care of ourselves. And I think that was a really big struggle for a lot of individuals in the community. So what it brings us to, though, is at the end of the day, when we recognized that the pandemic started out and was in its onslaught, we anticipated and expected that it was going to be a very difficult time. And our entire goal was that we had to figure out a way to pivot services and continue to provide families and children and other victims of abuse with the ability to continue to find hope in their lives. I think when the pandemic started, there was a huge sense of hopelessness, and as it continued to last throughout the last year, we saw that grow, which is why we saw things like child suicide and mental health issues and increases in drug and substance use for coping, because the survival of our people was genuinely placed at risk. And so part of our Family Justice Center framework, part of the services that we provide is specifically with the intention of helping people rebuild their sense of hope. And the way that we best describe it is that hope is the belief that your future can be brighter than your past and that you can play a role in making it happen. And that's what our goal is we had to figure out a way to provide services to people in a way that was going to pull them out of that sense of hopelessness and give them an opportunity to feel like they could recover from their situation while we lived in a world that had very significantly strapped resources and placed a strain on our community as it relates to the providers that we have here in the room today. So what that looked like for us is we had a lot of people that we served last year. I think you're going to hear throughout the rest of the day that the numbers don't always seem like they went up and they didn't always seem like they went down, but we definitely assisted lots of people. And so in 2020, when we looked at our stats, we had the opportunity to serve just over 3,600 people countywide here in Riverside County. Of that percentage, 24% of them were children, and that accounts for this 897 youth that we provided assistance to. And what we found is that when you break that down into business days, that's 14 people a day that needed help every single day. And so while I cannot represent to you that the numbers went up as it relates to calls for service, I can tell you that we were absolutely steady as it relates to the services that we provided in the request. And I can share the sentiment that the nature of abuse was much more significant and much more egregious. And that's what takes us here to this. I pulled a few news articles from just the last month, specifically from Riverside Police Department, because they're a partner on site with us in our Riverside Center. And I think this is a good representation of what we saw throughout the months of the pandemic and what we're going to continue to see as we move forward. Child sex abuse is a very pervasive issue that we've come across, and it's the #2 crime type or abuse type that we see from families and children who self-report in the center. The very first crime type that we see is domestic violence. And most people don't recognize that domestic violence can have very fatal consequences, resulting in the loss of life. In 2020, we saw that we assisted 10 families that were involved in murder-suicides related to domestic violence or just straight up homicide. And typically when we get involved with these types of families, it's often because there are children who are left behind, who witnessed the event, and who are now displaced as a result of the domestic violence fatality that occurred. And we assist them with relocation in collaboration with our partners such as Child Protective Services and RCAT and all of the other speakers that are in the room today. And so when we think about the nature of abuse that we've dealt with, it's true. The people who came to our door and the people who called us for help did have much more serious cases or instances of abuse. And that put a lot of strain on our providers because the need to respond promptly with significant services was very difficult. We experienced issues related to shelter and placement and having enough stability funds so that we can, hold people over to become in a stable position. That all came up quite often. But while this does sound gloomy, there were a lot of amazing things that we were able to do to help recover and practice our resilience in this process. And here's what it looked like. When we prepared for our emergency response, we put together a plan of things that had to be done that we anticipated would make a big difference. We also relied very, very heavily on some pre-existing infrastructure and services that we have developed with our community partners. And I truly believe that the success we saw in providing services during the pandemic was as a result of the hard work that we've already had with a lot of our partners. And so what this looked like for us is, number one, we put out a case plan to do a query in our database to figure out how many people we had served in the last 6 months prior to the onset of the pandemic in March. And what we did is we placed safety calls to people that we had served within the prior 6 months so that we could check in with them and make sure that they were okay and that they were faring through the pandemic as necessary, because everybody was placed in isolation. One of the things that I think is most impactful about the pandemic is that isolation is probably the worst thing that you could require a family or a child or somebody who is prone to abuse to do. And the reason for that is because it creates opportunity for reoffenses. It creates opportunity for their abusers to have more access to them, and it prevents their ability to reach out for help and to get the services that they need. So while we did have an instance of getting to hear about abuse cases as they were reported to law enforcement, I think that over the next year, we still don't really know what the impact of child abuse is going to be as it relates to the pandemic, because I think there are still a lot of kids at home right now that haven't had an opportunity to tell anybody about what's been going on. So outside of that, we also found a situation come up where most people didn't even think anybody was open or they were available to provide services. So we instituted a plan to get with our community partners and to have some ongoing dialogue during the pandemic about who was open, what services were available to them, and what specifically we could do in the moment if we had an emergency. I think that this year was the year that we exchanged probably the most personal and work-related cell phone numbers, because we really found even more value in trying to make sure that people knew what was coming so that we could forecast the need and anticipate specifically what the need was going to be for a lot of the children that we worked with. Some of the very successful partnerships that I mentioned about proactive advocacy include our partnership with RCAT. We sit on a patient services committee with the advocacy providers who provide support to the children who receive exams and interviews at RCAT. And that puts us in a position to know what is coming in and to put us in a position to respond to the needs of those children right away after their interview and after their exam. And so that really cut out some downtime for us and increased our ability to provide immediate response with our local child advocacy centers, because we had that unique relationship and we knew what was coming. In addition, it helped for us to negotiate any services that we weren't able to fill the need on and figure out what the next steps were going to be, because we had that proactive communication. We also worked with our local law enforcement agencies. Thankfully, we have several detectives from various departments in our Family Justice Center locations. Some of them are assigned full-time and some of them just come by as needed. But what we were able to do is put the word out to them that if they encountered a serious emergency, this would be their point of contact and this is the steps that they would need to go through to get immediate services. And sometimes that resulted in us negotiating with the hospital during a forensic exam to help get that person to a safe place afterwards, and we were able to arrange transportation. Or it required that we set up a special room so that the law enforcement officer could bring a survivor of abuse and their children to the center location so that we could figure out what the next steps were going to be as it relates to shelter. And so when we look at really what the needs are, one of the things that we found as being the most significant and serious issue of being able to assist victims was shelter placement. Our local domestic violence shelters went into a place of hardship where they had to reduce their bed space. They had to require quarantines of survivors before they entered shelter. And they also had to implement a testing procedure for COVID. In one of our local community partners, we partner a lot with San Bernardino, we saw that COVID affected an entire shelter and resulted in one of their employees passing away as a result of the disease. And that allowed for people to not be able to access the shelter for quite some time. So we had lots of personal employee safety issues and safety issues related to the public to keep people safe. And so that further exacerbated a lot of our housing crisis that we have here in the community. So we relied on methods like the California Victim Compensation Program, fundraising, and asking our donors for help with alternative placements. We actually utilized a lot of hotel assistance to place people temporarily and attempted to assist them with helping to relocate them to family members and friends in different parts of the community so that they could have a more long-term safe place to stay. In one instance, one of the events that we saw that I think was, a testament to what we were able to do is we had a survivor of human trafficking who was recovered with 2 children, and she had been brought here from the East Coast. In the situation that occurred, it was a domestic violence situation that first started, but on the onset of the pandemic, they needed to make money, and her boyfriend told her that it was necessary for her to go out and work, and so he put her on the streets while the kids remained in a hotel room. And so when she was recovered, we worked with the family who had no idea what Riverside County was really about outside of the times that she had been on the streets. And so we really had to start from square one to figure out what the next steps were. And it was those relationships with our partners that helped make that process go as smoothly as it could. When we talk about a sense of hopelessness, I think it's important to note that the pandemic placed more barriers up front for victims. We had issues with people not being able to contact service providers because there were telecommuting schedules or things like that, or they were just inundated. And so it took a little bit more extra time for people to call back. But when you have situations like that come into place, especially when you're working with survivors of some type of abuse, the level of desperateness is much more severe. And so it was very mindful in our position to try and be as responsive as possible and to be able to talk to people about their immediate safety right away so that we could address those issues, because we knew that if we didn't assist or get to them in that time, the likelihood that they would call us back and be ready for services again was probably going to be very slim. So the sense of hopelessness that I talked about earlier was very significant. What we did is, specifically working with our youth, we realized that there was a lot of work that needed to be done. And I can represent to you today that, there were things that we did right, and there were things that we could have done much better. And so the things that we could have done better, I think, would have been looking for ways to engage our youth in person sooner. I think, obviously as a manager, my number one goal is the health and safety of my staff. And so if it wasn't time for us to meet in person, I needed to make sure that they could continue to work and continue to be available to answer the many, many phone calls that came in. And the result of that was that we weren't able to engage our youth in person as much. And so that worked to a not beneficial area, because when you think about it, our children had all of their livelihood taken away. They were isolated, they were no longer able to see their friends, they were stuck at home. And we have a lot of kids in our community who lack significant resources. And so sometimes school was the place where they actually got to feel normal and be normal, because that's where they had access to the materials they needed. And all of that was taken away. So if we could do it again, I think it would be very important that we look for other ways to safely meet with people in person, so that we could have at least gotten them out of their house a little bit longer. But what we did in the meantime to deal with some of the issues that they went through was we incorporated some digital programs. And so we have social emotional learning programs on site that allow for us to build crafting materials and provide them with contactless kits and pickup kits, and allow for them to have an opportunity to meet with us online, so that we can talk about the issues that they're dealing with and give them some opportunity for enrichment. So through our youth programs, we had the opportunity to make all of these crafts. And you'll see here that even the Hope Collaborative was able to assist us with building out family enrichment packets or baskets, so that we could let our families know, hey, we care about what's going on with you. We want to make sure you guys are okay, and provide an opportunity to reach out to them for services and just do a check-in, so that we had the ability to keep eyes on them, because we knew that some of our families who were at risk were struggling much more than they probably would have if it were a normal year any other time. So moving forward, one of the things that I want to talk about, in addition to the way that we developed programming, not only did we just try to hold on and make sure that people were served during the pandemic, but we also tried to take a lot of internal learning and do some introspective work with our agency, so that we could adapt and figure out what the next steps were going to be. So for a lot of people, services went on hold during the pandemic, but that was not the case for us. We continued to be busy. We continued to realize that we needed to pivot and grow. And so we worked on several different things. One of the things that we did, again, is we were, continued our partnership with our child advocacy centers, but we also instituted some technology services so that we could work with people on Zoom. We now came into a position where we could work with a working mom during her lunch break who was in need of advocacy services, because we no longer required somebody to come into our services for an intake in person. It also reduced the need for people to travel. And so as long as they were safe and being able to talk to us, people who were in mid-county or in an area that did not have a centrally located family justice center now had additional access to us for services. And then what we found is that the need was so high for many families that we were able to provide a very good informed consent process. And we found that more families consented to allow for us to partner with other community partners to help get their needs served. And so it was a great opportunity for our families to see that we really do work together, and that we are able to share appropriate information to get these individuals served. The very last thing that we did is we instituted a thing called the Aware to Care Exchange, which I don't want to give too much away because I assume that it will be talked about in the next presentation. But we were very mindful about the presence of adverse childhood experiences with our families. And we partnered with the Department of Education and the Riverside County District Attorney's Office to be more mindful and be responsive to the ACEs that our kids were experiencing. And so I'll let the next presenter talk about that. The very last things that we put together for everyone is we put a huge focus on our youth programs. Again, they were digitally provided via Zoom, but what we did is we also instituted some additional programs related to working with the schools and the Riverside County District Attorney's Office Crime Prevention Unit. When we talk about proactive advocacy, really what that means is for you to assess your system as a whole and figure out where you can proactively reach out to an individual instead of waiting for them to call you on the brochure or the card that was given to them following the trauma that they experienced. And so what that allowed for us to do is we have victim advocates who are assigned to the crime prevention unit at the district attorney's office. And what they do is they oversee truancy issues at local school districts, and they participate in the SART and SARB process that we heard about earlier. And so the purpose of the advocate being involved in that situation is so that we can provide a safe and confidential place for families to potentially disclose or share about some of the hardships that are giving them grief, or that may be embarrassing, or provide, you know, them a hard time as to why they're not able to get their child to school. And we have found that domestic violence has played a huge role in a number of these families that we're working with. So it allowed for us to reach out and talk to them about how we're concerned about them, and we want to know how we can help them instead of placing them in a position to call us and say, what can you do for me? And I think being able to build that rapport really does make a huge difference for us. In addition, we instituted the Parent Project, which is a 10-week curriculum that we brought back during the pandemic, because we realized that a lot of families that we were working with had a lot of hardship related to parenting, you know, staying at home, working, trying to figure out what to do, and having grief, as we heard Dariana say earlier, about having to leave their kids home all day so that they can keep the family running, put a lot of strain on individuals. And so we put together this parenting project that's hosted by one of our supervisors in the desert, and she was able to facilitate it online. So it gave our parents a little bit of a sense of community to talk about some of the really hard issues that they've been dealing with this year. The very last thing that I want to share with you guys, just so I can stay on time, is that what we found during the pandemic is that there was a lot of hardship. There were a lot of concerns and pivoting that we went through. But at the end of the day, what we found is that we have a very, very resilient community. And our community is also very collaborative. And all it requires is that you call and say, hey, what are you guys doing? Is there a way that you can help me? What do you guys have going on? And so I think what it's done most for us is it's increased our ability to connect and talk to individuals about what the needs are. And when the community has the opportunity to see that we are resilient providers that can assist them and will attempt to assist them the best way possible, what we find is that then those resiliency factors are imparted in our families that we work with, and it helps us become a much stronger community. So what I want to share with everybody at the end of the day today is that I'm very proud of the nature of our resilience, and I know that we're going to be okay moving forward. And there is still a lot of work that we need to do related to child abuse prevention, but I think we're on track and we're doing exactly what we need to do with the people that we need to be with. And that's my time.
Wow, what an ending to your presentation. I think I needed to hear this. I was sad throughout various points of all of the presentations, just hearing like what we're dealing with and the families' problems that we're serving. So thank you for ending it on a positive note. I think we have shown, I know that in our community discussion, there was some points about people adapting, you know, so that I think that showed a lot of resiliency, and I know that that's going to help us continue to do better. And I just needed a little bit of positivity here. So thank you for including that in your presentation. You know, thank you for everything that you do. I want to say the last 3 presentations have really shown that you guys are the ones that are there when families are going through the toughest of times, and you're like right there immediately to provide that support. So that's beautiful to see. Are you guys open in person now? I just had a family recently asked about that, so I'm curious.
We are, but it's still a modified schedule. So we have our lobby open from 10 a.m. to 2 p.m. every day. And then what we typically do is we'll try and schedule an appointment with most people so that we can COVID screen them and do all of that. But the purpose of having open lobby hours is because we recognize that not everybody has a phone or access to technology. And so we want to be able to provide some time right now while we're in the interim for them to be able to self-report.
Thank you. So we do have about 4 minutes if anyone has questions for Katie. I see a lot of thank yous and great presentation. Let's see, is there any specific services support offered to senior adults?
So at this time, yes, but it's very limited. So we provide, the most common service that we provide is restraining order assistance to senior adults. And then we also partner with adult protective services and other community partners to provide more emotional support. But any person, any victim of abuse who comes to our center will receive an intake, a needs assessment, some paraprofessional counseling related to sort of validating their issues related to trauma and the, conversations that need to be had related to, what's going on with them. So unless there's something more specific requested, that's really essentially what a lot of our senior adults get from us.
Another question we have is for the parent project, how can we get more info on when the classes start? And is there a flyer that can be emailed?
Yes, absolutely. I think Monica is in here today. Monica Podlesny is the supervisor who oversees the parent project in our region. And so she'll upload something today for you guys.
Thank you. You said she's on this call today?
I
Do you
believe.
mind if we share your email on here in case they want to follow up? Would it be you that we contact or?
No, I'll add it. I'll add Monica's.
Okay, thank you. I'm like, I don't think we have that email, so thank you for adding it. All right. So let's see. Well, thank you so much, Katie. If you have any other questions for Katie, please include them in the chat. And at this time, we are going to, well, first of all, let me give you your virtual round of applause. Thank you. Okay, so our next presentation, and I know school-related struggles were huge, both for children and parents, and they continue. Things have gotten significantly better. But it is definitely one of those situations that cause a lot of stress to families in general. So our next presentation, hopefully we'll touch on some of that. And we have Mike Barney, who is the Executive Director at our Riverside County Office of Education. And he will be joined by Renee Ramsey, who's the Coordinator for Leadership, Innovation, and Outreach, also for Riverside County Office of Education. Their presentation is called Students, Families, and Educators Served Through Riverside County Office of Education by Instructional Services and Leadership, Innovation, and Outreach. So everybody welcome Mike Barney and Renee Ramsey.
Well, thank you very much, and thank you for inviting us. This was a interesting first part of the workshop, or the conference, I should say. I think what we're going to offer this part is, which was interesting at the beginning. I think the way you grouped people was wonderful. The idea that it's direct services to helping kids in need that are in severe need. And so it's talking about and what was really needed. What Renee and I are really going to talk about is how my unit, in particular, instructional services, supports teachers, administrators, and district leaders, mostly in the educational services aspect. So if I do want to kind of reiterate, our email addresses are right here. So if you do need to get anything out to teachers, administrators, or districts, let us know. Keep in mind, we're about 423,000 students in Riverside County. If you add San Bernardino, we almost get up to a million kids because they're at 4 something, at the high end of 4. So we have access to a lot of kids, and I realize you're probably sending things out to our local districts, but if you want a second nudge, Renee and Renee's got some things at the very end that she'll talk about that I think is important, that you can maybe put some of the stuff that she talks about and access that. And really, we can just be another nudging tool for you to get some of this word out. I think one of the things that struck me at the very beginning was that PDF about what to look for on Zoom. I don't know what I missed, and did I zoom by that email or what happened? But I had never seen something like that, and I think it would have been a valuable tool to reiterate back to our districts over and over again. And what we find in at least K-12 education, that you do have to send it out through multiple channels if you really want to hit the biggest audience. And we realize you're probably going through student services, the directors that are handling suspension, expulsion, health issues with our students. But my unit really will be talking to teachers, site principals, and leaders, and same with Renee's. Renee actually has some other nuances that she actually directly connects with too. So do keep these email addresses. I did put in the chat our presentation. So I'm gonna, for some reason, I did not hit enter. So that probably doesn't help. So if you want access to our presentation, feel free to go ahead and click on that link. All of our information is linked in the presentation, so you should be able to access everybody. Again, my name is Mike Barney. I'm the Executive Director of Instructional Services for Riverside County, and I'm so happy to be joined by Renee Ramsey. And Renee, go ahead and introduce yourself and we'll get started.
Thank you, Mike. So like Mike said, I'm Renee Ramsey. I'm one of the coordinators at the county office, and listening to this morning's presentation reminded me of what I miss from the school sites. And even though it's a really tough topic, that was the connection I loved working with students, is working on when they were having struggles, when there was abuse. And even when students trusted you enough to come to you and say, I need you to help me contact somebody or get resources, whether it was students coming for that or parents coming for that. So this morning has given me goosebumps, because now that we are removed from the site directly, you know, hearing everybody talk about it again, it gives you those memories. And even though Mike and I now work at a more global level, you know, because it goes from school site to district level to county level. And now that we don't have everyday contact with students, we have to remind ourselves that the work that we do and give to others impacts our families and our students directly. So we try to make sure that we don't forget what we've experienced at the school sites, and then also stay current with the things that are changing, especially through this pandemic. So very excited to talk to you guys today, but more so have been much more interested in what everybody's had to share today, not only being an educator, but also being a parent of 3 teenagers. So there's a lot going on, and with them personally, but also, you know, their friends and things like that, and teaching them how they can help each other and, you know, students they go to school with when they notice something, and it's not just the teachers that are recognizing. So it's really nice to hear about everything. So I'm going to turn it back to you, Mike, and I look forward to sharing some of our work in the later slides.
So what we're going to try to do is answer a few questions that Dariana gave to us to answer, and we'll hopefully look at it. Some of it is going to be no kidding, Mike, and I realize that, and some of it hopefully will be some nuances that we'll offer you as we look at this. So our first thing is what are some of the trends that we started to notice during the pandemic? The first thing that my team did as we looked at it is we really had to look at the services, because again, we're direct services to teachers, principals, and district leaders within ed services, to be clear. And so what we had to do is, the first thing we had to do is we really had to look and start asking ourselves some questions. So we really needed to look at what's the kind of staff development going to look like? Because like a lot of you, we all of a sudden closed our doors in March and we had no clue what to do. And so thank goodness, as you found, you have wonderful teams, we have wonderful teams, and we figured it out. And so we had to look at what are we going to do virtually? And then more importantly, what do our districts need? Because Mike and Renee can give them stuff, but if it's really not what they need, then it really is a waste of our time and of course, their time. The more important thing on my end, because I'm instruction, is how are we making sure the implementation of whatever they're trying to do is successful? And then the other one, which we talked about at the very beginning, is how do we reach our educators, again, through this more virtual way versus a more face-to-face with our traditional. And then the other one is asking how do we best reach families, which Renee will talk about at the end. And then I think we all have to deal with how do we make sure our kids feel connected. I just heard from one of my support people. She's got a 12-year-old daughter, and she said her daughter was doing okay with Zoom and she was passing her tests and stuff, but she was missing something and she was starting to withdraw. And now that she's back in school, she really is fully engaged, and it really has brought in kind of a new way. And I go back to the presenter that talked about hope. And I think it gave, going back to school, actually gave her hope because she started to connect with her social relationships, with her relationship with her teacher, with the other relationships that she has with the adults at schools. So the first thing we did is we added virtual coaching. And we know that a variety of skill levels amongst our teachers out there. And so the first thing we did is we added virtual coaching. So any teacher, any school, any administrator could make arrangements to meet with us virtually and provide the support they need versus the support we would give them. So they would ask us questions and we would help. And so we immediately went to a virtual coaching model, or was one of the services we provided. The other thing we found out is there's a bunch of tools out there, and I've got a few up here. Desmos, if you're not familiar with Desmos, it is for our math friends out there. And it is a graphing kind of website. It's actually free, mostly to educators. So it's a great little website. If you do have some secondary kids that have to graph things, it's actually a neat little website to go to. I'd recommend looking at. Again, if you click on the word Desmos, you'll go to that site. And then Pear Deck, if you're familiar with Pear Deck, it's a fancy way to doll up your presentations. Teachers use it a lot because it helps with the interaction. So it becomes very helpful. And then the other one off to the right-hand side was really one of the tools that we came, and you really can't tell, but this is actually Jamboard. So one of my administrators, Molly McCabe, Dr. McCabe, uses Jamboard to help kids with sound symbol relationships. And so if you're familiar with Elcon boxes, this is the digital version. If you're not familiar with Elcon, he was I think in the 1920s or 30s, Russian researcher on reading. Anyways, he used paper and pencil. We are now, of course, using Jamboard. So it's using those kind of tools. If you click there, you'll have a video on how Molly did that and give you some ideas. If you do have some small kids at home that need their sound symbol relationships, it's a good tool. Or if you have other people that need that kind of relationships, that kind of help, that website will offer to you. The other thing is we had to change our website. As I talked about the Jamboard, it's a YouTube video. So we now do everything asynchronous. And I'm guessing with this conference, all these presentations will be passed out in asynchronous. So if somebody missed something, they can rehear those presentations and jump around to presentations. Certainly if they missed, if they weren't, they had to get up at one point during the presentations, they can go back then and look at it. So we had to provide a lot of those kinds of resources for teachers. So almost everything that I'm talking about today, what you'll find it on this slide. You just have to click on it and it'll go to our RCOE instructional services web pages. But I do want you to know, and I should have brought it up earlier, there's literally 15 other units that assist teachers principals and leaders, parents, and students within Riverside County. Some are direct services like our alt ed and our special ed, and some are like Renee and I, a step back. But just know that our website is a great resource for the variety of units that touch kids in Riverside County in particular. The other thing we had to do is we had to think of how do we do our conferences different. So we had to utilize different tools. So of course, we utilized our web tools more so, which is up here, which is at the top, the responsive web series. So it gives a big deal. Our conferences, we didn't do, we did one, our Ed Symposium was half day, but a lot of our keynote ones that we historically do, which are 1 day conferences kind of things with one keynote, we did typically with Mirko here on equity. We had him come in 6 times. So he came in one time every month for 6 months, which was wonderful for an hour after school. So teachers could come no matter what to that, which was great. And then what about those teachers that want to extend that learning? So how do we do it asynchronously? So I talked about that we use YouTube a lot, but we also use another tool called Alludo. Alludo's a asynchronous way to take in a lot of content. They call it the gamification of learning. So it's just another tool that we use coming in. We are hearing back, and I'm hearing back from my team that Alludo is helping with the implementation. So they'll go see Mirko, for example, and then they can jump on the Alludo activities about cultural responsiveness and the stuff that Mirko talked about. And then they can try things out, and they have to upload examples. And so we're seeing better implementation because we're using Alludo. So those other resources out there that can help, and that we really transformed the way we did conferences on how we did things. And then people have already brought this up, but we had to jump on also the SEL, the social emotional learning bandwagon, and make sure that they're connecting. As it was said from one of my people that talked about her daughter needing those social connection, our work is all about relationships. And so how do we turn that on? And then Renee brought up, how do we help our kids build relationships and connect with kids that maybe are struggling, so that they can have peer support as much as the adult in the room supporting them. So we started developing lessons for teachers to help in the SEL, or the social emotional area. And again, those are posted. We did that actually early on at the beginning of the year, because we figured when people come back in August and September of last year, that SEL, they needed to connect with their kids because it was a brand new platform, that virtual platform that we are going through. And then I'm going to go ahead and pass it over to Renee, because really a lot of the stuff that she does is really connect, not necessarily directly with families, but it is the support towards families. So Renee.
Thank you, Mike. So as Mike was talking about, at the county office, we have so many units that address a lot of different needs. And so even though Mike's unit is about instruction, the unit I'm with, Leadership Innovation Outreach, is a unique unit, because we kind of work with all the different units. So our unit, as Mike's unit, works with principals and administrators at school sites and what kind of training they need. We hold network meetings in our trainings, so administrators can just talk about some of the commonalities that they're seeing in their schools, because schools, as we know, have different demographics and they have different things that are going on. And so sometimes administrators just need time to talk and bring up things that are happening around Riverside County. And it's like, was discussing, when we serve almost up to 430,000 students across Riverside County, we have a pretty big reach among those 23 school districts. And so when we talk about how do we provide hope and support to families, another piece of my unit is we work with parent engagement. Now, there are a lot of other units within the county that also work with parent engagement. But one of the things that we do is we want to hear what our parent liaisons from each of the districts are hearing out in the districts, because since we're not on campuses directly, we can't get to every place directly, we need to reach out to our ambassadors that are out in the districts and ask them, what are you guys hearing? What are you hearing from students? What are you hearing from parents? What topics are people talking about? What do they feel that isn't being addressed? And so that has always been, you know, the work that we strive to complete and create and rejuvenate. But when COVID happened, it changed a lot of things. A lot of people became scared and they felt like they needed to know more information urgently, even though everybody really didn't know what this was going to look like. So we had to start thinking outside the box. Like, how do we provide hope to, you know, when Mike's department's working with teachers and administrators, now how do we reach our families? And you guys all know how hard it is to reach families, and that's, you know, one of the barriers that we talk about. But one of the first things that we did was we decided, well, let's hold a virtual summit. And the county office is not the specialist of everything. We don't know everything, but we do know how to contact specialists that are going to know more than we do. And so on the screen, you can see is this was the immediate conference that we created right when COVID happened. So we held this conference in April, and we contacted specialists across the entire nation, whether they were going to talk directly to parents about social emotional support they were probably going to see that was going to be happening at home, whether it was needs for students directly, whether they were pre-K kids, all the way to college level, and they even had strategies to help support parents in that area too. But then we also had not only from social emotional support specialists speaking, we had all the way to Harvard professors talking about if your child's at home with you and they're freaking out about, I'm a senior this year, how am I going to fill out my college applications and be able to volunteer my time and get into the college that I want to get in? And, you know, that's a whole different type of layer of stress. So we tried to reach out to all different specialists, do interviews, have them talk about the different strategies directly for parents. Then, even though we held it live over a week, we also made sure that we recorded each of those and put it in a way on a website, which you guys can see the link there, that parents, if they missed something, they could go back and watch a topic that they wanted to listen to. Because as we all know, there are a lot of people that have various needs. And if I don't have any college students, I'm not going to want to listen to the Harvard professor. So I might want to listen to somebody else. So not only did we hold these conferences and these interviews live, we also recorded them, and it's still available for people to go to now. And then all of those specialists also had resources for families to use too. So this was created directly for families. And even though this virtual summit is, you know, over, this is from last year, we're also in the talks of creating one for this year as well. But our next conference that's going to be happening that's current is on the next slide, which is called Surviving to Thriving. So this is an author, Dr. Michelle Borba. If you guys have heard of a book called Unselfie. So before COVID, we know that with how students, you know, internally think about themselves if they can. And so she came out with a book called Unselfie, like how do we teach our kids to think about others, to have that social emotional support, that empathy for others. Well, interestingly enough, she came out with this book called Thrivers, which actually helps a lot with the pandemics that are going on right now. And this book is about the 7 characteristics that you find in students that can thrive through difficult situations. Example, COVID right now. And so we partnered with her and we decided, let's have her speak directly to parents about the hope that your child, even though they're going through stress, you can still instill certain characteristics in them that will help them get through these difficult times. And we know there's a lot of different layers of difficult times. So tonight actually is our 4th week of this series. We had a whole series this month, but we're repeating this series in June. And it is created for parents, for families. Educators are invited. Outside specialists, community members, anybody's invited to it, but it is created for parents to talk about the struggles students are experiencing in the past, things that they're experiencing right now and things that they're probably going to deal with in the future. And how can you provide support and teach these things and these strategies to children to still get through it? And so this, even though it's created for parents, it's also very nice for educators and support staff to know what these characteristics are, because as you know, some of the families that you work with, these kids are also going to their social workers and to their teachers for support too. So this is a free conference. You guys are more than welcome to join it, share it out with anybody that you guys would like to. The link is on there. But at the same time, we started talking about an additional conference. So Dr. Judy White, who was our previous county superintendent, she has recently retired, but she made sure to stay in contact with RCOE clearly. And she also partnered up with San Diego County Office of Ed and San Bernardino County Office of Ed. And they decided, how are the kids and the families going to deal with returning back to school, recognizing that there's been 2 pandemics? Not only do we have COVID-19, but we're also talking about how families and students are feeling about returning when there's all these conversations about equity and racial conflicts and all of those things. So COVID came in when all of that was happening. And so it was a discussion of how do we create a conference for families to learn about how to deal with different feelings that are happening with sending their kids back to school. Are their kids prepared? Are the parents prepared? Are the teachers prepared? So coming on June 24th, we have a keynote speaker, author Miles McPherson, that you can see on the screen. He's going to be speaking about that hope and how to return back to school and how families can support each other, how they can support their kids in returning back. So there's links on here for a flyer in English, a flyer in Spanish, even things to put on social media, and the link to register for this. Again, it's created for families, but it's open to everyone. And anybody that joins will also be able to walk away with activities, like a calendar of activities that families can do at home to build unity and to look at the strengths in each other instead of looking at negative aspects. And so it's more to bond families together. So that's yet another conference. And so when we're creating all these conferences, we're trying to take in all the information that we're hearing from our parent engagement liaisons within the districts, because families feel much more comfortable talking to the liaisons than they are to their school administrators or to the teachers. And so there's often a disconnect that we're hearing. So we're just trying to respond and create things according to what families are asking for. And Mike's, team works on the instructional piece and those pieces that are missing. And part of our unit works with what's missing around parental engagement. But we're not the only unit that works with parental engagement. So on the next slide, it talks about some of the resources on the county website. And a lot of families do not go to the county website for resources unless they're looking for something specific. They usually go to their school site website, they go to their district website, and they don't typically come to the county website, but we do have resources here. So on the left-hand side, when somebody goes to the county website, there's a parent tab and it brings you to this page. And as you can see on the screen, there are a lot of different options, but a lot of families that their kids go to county schools because their districts don't provide the type of schooling their child needs, whether it's due to discipline, whether it's alt ed, whether it's special ed, and they need extra services, they can go here to find the schools, the information, things like that. But on the right-hand side, there are tons of different opportunities for families to learn more about things that are happening currently. So one of the things that they're talking about is financial literacy. Students are growing up and becoming an adult, and they're already in debt. They already don't know how to get out of that. And so that's the next conversation of how do we start having this conversation with students at a young age? Because if they're in situations that they feel like they have no hope to get to college or to be financially stable, they actually do have that chance. They just don't know the opportunities that are out there. And so this is just an example of the different things that we do have. But on the top, in the middle, but it's on the top right-hand side on the website, it says family engagement, which I'll talk about in a minute. that is a tab that just has tons of resources for district levels and school levels on how to improve their family engagement, or how to grow their family engagement, or how to even change it up if they've been doing something similar for a lot of years. So that is just some of the things that we do. But on the right-hand side, as Mike has expressed earlier, is that we also know that families and students are looking for some type of normalcy in this past year and a half, that they've been stuck at home. They don't get to play their sports like they got to in the past. They feel that disconnect. And so some students really have a passion around academics, and the county holds academic events, history day, spelling bee, mock trial, science and engineering fair, academic decathlon. Some kids love sports, some kids love academics. And so parents were expressing, like, how are my kids going to still connect to this? This is what they love. This is what drives them. And so at the county office, we decided, all right, we somehow got to turn this into a virtual event. So thankfully, even through COVID and everybody stay-at-home orders, students were still able to participate in these events and even qualify for state level and national level competitions. So if you go to the county website, you can find these examples of things. But that's that hope that parents said, my kid was so happy to be part of this because they felt like something was normal. They got to see other kids doing the same things. They got to work on projects of things that they were passionate about, not just things that they had to do. So just 2 examples. And then on the next slide, there's 2 more examples of the website. How I had said that there was that orange tab on the previous slide that said family engagement. So one of the things our unit does is, again, work with parent engagement leaders and liaisons. And every district has different needs, and they request different trainings and different supports. So what this unit does is, one thing is they have a network that they bring together all the parent engagement leads, and they let them talk and collaborate and discuss what issues are going around the county, right? All of Riverside County, but it also lets them celebrate the good things that are happening. So it's a twofold, but then also, we also have to remember that, how do we communicate with families? So as Mike was talking about before, communicating with school sites, communicating with administrators, communicating with the families, we decided, well, we need to create a newsletter that is going to take what all the different units in Riverside County are doing. So even though our units are together every single day, our focus is to reach parents and create things for families. And so this newsletter takes a little bit of information from all the different units and puts the events that are going on, the celebrations, the calendar trainings that are happening for parents from all the different units all into one place. And so there is a link on here that if you want to subscribe to the newsletter, just to have the information of things that are happening in Riverside County from the county office. It's just informational purposes. It has resources in it, has links to places that you can find information. But this is also something that, if Mike was talking about emailing us, if you guys have resources or information that you know families would really benefit from, email us that information and we'll add it to this newsletter, because this is what's going out to our parent engagement leads across the county. This is what's going out to some of the families that have signed up for it. So it's a good resource, and we would love to have some of your resources to add to it, because we want all of it to get out to who needs it. And then on the right-hand side talks about people in administrative services. So Katie, who was talking right before us, she was talking about ACEs. And so even though Mike's unit and my unit don't work with that directly, it's our pupil and administrative services department that does it, Dr. Susan Levine. And so this is a list of all the different services that this unit works with, whether it comes with schools or districts or families. And I mean, there's much more than that. So this is just, a brief summary of what they do, but every single one of the county units also customizes things for district and school sites that ask. And they say specifically, we're okay in this area, but we need more support in this area. So this is just examples of all the different things that are available from the county office to support districts, which then support their school sites, which then support direct families and students. So just a little bit of information. There's a lot more. So when we look forward to the next part, it talks about some of the family engagement resources. So how we talk about customizing it, I already talked about the Family Engagement Network, where we bring everybody together to discuss and share resources across the county for families. But we also have a training. We've partnered up with UCR to create classes that parents can take that either want to volunteer for their school or they want to get hired on with this school and learn, how can I be a family engagement liaison? How can I know what's going to benefit the school site? What's going to benefit the students? What's going to help with being collaborative partners? Because as we know with COVID, it's not about the schools or DCFS or to be able to do everything. We have to partner with families. We can't do it alone. And with all the kids being at home this past year and a half, we realize that we have to build the capacity of everybody, right? So that's another little resource that we work on. And then the next little bullet says the action team for partnerships is just another resources that we work with districts and schools directly to create goals around what families are asking for, what to spend money on to support. And again, every single district and every single school has a different need. So it's very specific to each team. And then again is the parent engagement newsletter that we put on there twice, because that's one of our communication tools. So then we talk about, after the family engagement unit, is how we talked about that the county doesn't seem to have direct connection, but our direct connection is using our experiences, right, to go back and connect with the districts and help them build up their school site. But we also are looking at families. How do we help them engage in how to communicate with their school sites, with their districts, and even the county office to express their needs and what they're asking for? And so it's very different this year, but our goal is to reach as many families as we need. And we partner with outside companies. We partner with, colleges. We're partnering with you guys right now because you guys hear different things than we hear directly. And so when you let us know things that you're hearing from families and you communicate with us, and we can start creating things, and partnering with you and getting these out to our districts and our families, that's going to reach more students and more families. So our goal is to collaborate with you guys and with other partners to make sure that we can do that. So we really appreciate being invited to be part of this conversation, because again, we all are partners and we all want what's best for students, whether it's with students directly, whether it's with their families, whether it's with the teachers or the administrators that are reaching these families. We just want to be able to create all the resources necessary for that hope piece. So if you need information about family engagement, or you want to get information out, or you don't know who to contact in the county office, please email myself when it comes to that, or student events. And then Mike Barney is going to be the one. He works a ton. His whole unit works with instructional services and the teachers and the administrators. So between both of us, we communicate all the time because we have to make sure that we connect people with the right people. But we have to collaborate all the time. And because of Zoom, we're able to do that a lot easier now, right, Mike? It makes it a little bit easier to communicate, even though we don't get to do home visits, but we can partner up with different counties. We partner up with Kern County up by Las Vegas to create things. We partner up with San Diego. So it doesn't have to just be us in our little county anymore. We try to get resources from outside and make our work a little bit easier, because other places are doing some really great things too. So you want to add anything?
No, thank you again for inviting us to present. We really appreciate it. So, and thank you, Renee, fantastic. So I'll pass it back to our host.
Wow, right on time. I'm like, did you practice your speech to be like perfect timing? Because you were like spot on. Good job. Wow, it's incredible how much stuff and support you guys have put in place to try to alleviate some of the stressors and still be supportive of our families. I know the education system was probably one of the most impacted during this past year. So it's really nice to see the effort put forth by Riverside County. So thank you for all that you do. I feel like I was not familiar with a lot of this stuff. So I may have some follow-up questions after this. I do have one quick question, and you did touch on it a little bit, but one of the efforts that we do in various of our collaborative councils that we have throughout our counties is that a lot of the discussions is like, oh, let's try to connect with some of the school districts because we have the audience there to pass out this information or to set up this workshop at the school or at the middle schools or whatnot. And one of the things we've encountered is just how difficult it is to get the approval to do so. And we have some good connections with some school districts and some is just like practically impossible that we've kind of backed off from doing that. We know you are, you have the children there and parents, and that's the audience we're directly, wanting to get information on prevention to. So what would you recommend would be the best route for us to take should we want to put forward things like that?
So I think that it'll be a different ask. So you send us an email on saying, here's an opportunity for districts. And within that email will be, please contact so-and-so about this program. And so it's just a different ask. I realize you probably go to the district right now to get permission to send to schools. This will be actually me sending out an email or Renee sending out an email or a notice in the parent letter too. Keep in mind that information can be done too. It would be instead here's an offering that the Hope Collaborative is offering or Child Family Services is offering or something. And please contact this person for it. So it'll be a little bit indirect, but sometimes it's a way to, I don't know, nudge people in the right direction.
Yeah.
And
like Mike is saying, connecting you with different people. Our unit works a lot with our family engagement leaders that run the district parent centers. So sometimes we can connect you with the parent center because that's the area where families are going to for support. Sometimes a lot of times the families will trust the parent centers more than the school sites because they don't want the school sites to know all of their business, especially when it comes to these types of topics. And so a lot of families have a lot closer relationships with the parent centers. And some schools will send families to the parent centers if they have a strong one. And that's something we're trying to help support building up in each of the districts. And sometimes some districts have a hard time because trying to get through the materials or set up meetings with you guys to figure out, what you want to talk about or fitting that stuff in. There's different priorities or different vetting processes. And so sometimes we help, like I said, connect with our parent centers because that's where a lot of families go to for that support. So yeah, like Mike said, email us, whether it's, needing to reach out to somebody or a specific district or getting information in the newsletter. We can help with all that.
Thank you. I appreciate that. I'm really glad we made that connection. I think that's gonna go very far. So thank you. Thank you for your time and presenting for us today. This was so much information from your 35 minutes. I'm like, there's just so much to look into after this. So wonderful, wonderful, wonderful. I know myself and many others that have children in Riverside County schools are looking forward to, returning back to in person. I hope things continue getting better, but thank you for everything that you've implemented up to today.
thank you very much.
So a round of applause.
Thank you.
Thank
All
you.
right, so lastly, we do have one short presentation from First Five Riverside. And after that, we will be ending our day. So Let me introduce Barbara Andrade Dubransky, Deputy Director of Programs for First 5 Riverside. And she is going to be presenting on platforms for prevention. Welcome, Barbara.
Thank you. I'm glad to be here. I know that we're rounding out the end of the day, so I will go through it quickly. Do I bring up the presentation on my side? Is that the way?
If you can, do you have it
Yeah.
available? Okay.
Yeah.
I know you provided it to us, so if you need us to pull it up, we could do that as well.
That is.
You could just click next, easier.
So can you see it now?
No, not yet.
Okay, let me see.
Okay, there it is.
Okay. Just wanting to get it into presentation mode. There we go. There we go. Oops, sorry. So thank you all. And I'll try to wrap up our day by being pithy and quick. Many of you are familiar with First 5. Just in the event that you're not, a brief bit of background is that we are funded through a proposition that was passed in 1998 across the state. So every county in California has a First 5 commission. And that tobacco tax that was passed was intended to support children aged 0 to 5 and pregnant women. So we've been around for over 20 years now, First 5s across the state, and we have learned a lot about not only early childhood, but the field of prevention. So many of these you've probably seen before, but it's always helpful to just reground everybody in the reason we exist. That proposition was passed because we were able to learn through research and communicate to the public broadly that the majority of brain development in human life is happening in the first 5 years. And so it means it's a tremendous opportunity to serve children at this age and make sure that we're checking in on any needs that a child may have to develop their various components of their brain function, their social emotional function, their educational preparedness, being prepared for school, that we have this opportunity in that time to make sure that we're reaching out. So some of the things that we still face are knowing that developmental screening is a very powerful way to make sure that children are ready for school, but knowing that only 1 in 4 children, knowing that 1 out of 4 are at risk. But what we do know is that we don't have enough children actually going through developmental screening, so that we are not even catching, we are those few children who do need some additional support to make sure that they're ready for school. So this is sort of, a lot of impetus for why we exist, and we work across multiple platforms and domains. And so we invest, as many of you know, directly in services, and that's a way for us to learn about what practices work. But we also invest quite a bit in systems change and policy. So advocating for policies that impact this population and helping the existing systems that serve this population as part of a larger population they serve, understand the best way to address challenges in this age group and to support families with children of this age. And we do that so that the services that are needed are, those policies and those systems change are looking towards greater access for families, that the quality of the services that families come in contact is as high as possible, that there's coordination across services so families don't feel like they're navigating so many completely disconnected systems. And then of course, consumer capacity, meaning families understanding about their child's development, their knowledge, and their knowledge about the systems that they could tap into if they need support. And all of this moves towards our outcomes that children develop cognitively, socially, and emotionally, that that families and caregivers support the healthy cognitive, social, emotional, and physical development of children, and that children achieve optimal physical health and socio-emotional development. And that puts us in partnership with many different sectors, from families, the family support sector, the health sector, to the early learning sector. And with that, we were, as you all were, going about our business when COVID began, and we had a lot of the same themes arise that have come up already around the financial need of families, the financial need of the agencies that serve families. So we've made some investments in that area. Supplies to keep operations, particularly we have worked a lot in supplies for childcare providers, but also supplies directly to families through the programs they were involved in. There was a time, if you remember at the beginning, where just your basic household couldn't find, for example, cleaning supplies. Childcare providers had the same challenge. So making sure that we garner those supplies, sometimes applying for funds to purchase those supplies or receiving them through various funding streams, and getting those out. And as has also been talked a lot about, telehealth solutions. We were, like many of you, quickly having to figure out how to provide the services that our grantees provide through a telehealth solution. So that meant us providing various supports and including making sure that providers had guidance around how to protect the confidentiality of clients. So I won't go too far into this because it's something that all of you have experienced and talked quite a bit about, but we were there with you as well. And then, as we said, advocating throughout this, advocating, for example, that CARES Act funds go to the providers that serve these families, particularly childcare providers who were struggling with being able to stay open for those families who had had essential workers, and their children absolutely still needed a place to experience care. Not all children were necessarily at home with their parents who were on a stay-at-home order, particularly if their parents were essential workers. So advocating along the way for each of those. So those have been sort of the issues that have arose in this year and how we've responded to many of them. While this was happening, we were also taking responsibility in the county for the family resource centers, which had historically lived in the Department of Public Social Services, with a particular focus on both children's services as well as making sure that families had their basic needs met as one of the potential risks to family strength. So we are, as of July 1st, now responsible for the family resource centers at this time. Our Riverside location is open, our Mead Valley location is open, and our Mecca site is open, with an intent to open at least 2 more in the coming just over a month. And part of the expansion, the decision for First Five to partner with DPSS to oversee the FRCs is to expand and enhance what goes on at the FRCs. So we're really looking towards more family-friendly programming, while still making sure that families get what they have historically gotten, which has been a lot of focus on self-sufficiency services. So making sure those continue, but that we continue to increase and enhance our family-friendly services, our parenting services, our ability for someone to drop in and just ask questions about their child's development, etc. So with that, what I'll talk about in terms of what are we doing to provide hope and support to families, the way I would say it is, I think what we're trying to do is learn from what we have funded and what we've been involved in over the last 20 years to really say what should be brought to scale now. And by scale meaning, is this something that we think every child should have access to, then bringing it to the scale of every child having access? Is this something where from an equity lens, where this is a smaller proportion of families, but how do we make sure we find the families that need this type of support and can benefit from this type of support? So what does that mean for the sectors that we talk about working in? So for the early education, access and quality, it's reducing need for remedial education. So when children get to the K through 12 system, we want to reduce how many children are not ready and therefore need some kind of additional support. So that's ensuring they have a high quality early learning experience, that their early literacy is promoted in a variety of ways with in partnership with both their parents as well as their educators. For maternity and pediatric care enhancements, this means, and by enhancements, we mean having enhanced care coordination when children are receiving pediatric care or women are receiving maternity care. So this also reduces greater challenges associated with late detection by following a family closely and giving them various support. So for example, in a pediatric setting, that there is an evidence-based high quality developmental screening being used in that space, so that children are being either identified with a delay or disability as early as possible and are receiving referrals to a support, because many mild to moderate delays can be completely ameliorated before that child gets to kindergarten, and many of them just go unrecognized before that time. We understand the importance of community connections and safety net navigation as part of the key in prevention. And so this is preventing poor child and family outcomes broadly, particularly as it relates to child safety and social outcomes. And what we know is just that families are extra motivated to navigate public systems when they have a pregnancy or a young child. There's an exceptional level of openness at that time, and it's an optimal time to support families in learning how to navigate systems that they may need at that time or may need years down the road, so that by the time that need arises, they are more comfortable with systems navigation, and they know that they have places they can contact. They know they can go to one of these platforms. They know what they can ask their childcare provider. They know what they can ask their physician. They know what they can ask someone at their local FRC, etc. And then finally, integrative approaches, and this is just improving that multi-system functionality. You know, that example being a very simple one, being, as I mentioned in the FRCs, that if part of what is a challenge in maintaining custody of your child is your basic needs, you're getting those met, but chances are if there are a lot of stressors in the family around basic needs, there's some other support that might be needed. You know, hey, I work 3 jobs. You tell me I should read to my child every night. That's not even possible. That there are other ways that a family can be supported so they can get those types of needs met. And that the more they can do that in one space, the better, or in a way that requires minimal shifting and navigational points, as few as possible. So what does this look like in practice, as if we have these platforms functioning as we would like? Then what we have is a system of targeted universalism. And that's a way to think about equitable distribution of supportive resources to families, recognizing that all families have some need, and that with assessment and screening, we can really assess, here's a family who we would offer them whatever is a universal platform, but we may offer some additional preventive care or offer assistance navigating the safety net. And these are, so I like to think of these as thinking about prevention from the promotion perspective. Universal platform, that could be public education, that could be one home visit. Every baby that's born in this county gets one home visit, something like that. To preventive care, where that's what I look forward to. And then being a primary prevention, and then when families are navigating safety net systems, thinking of it as secondary and tertiary prevention, and making sure that we provide, we make offers to families based on an equitable sense of need, which requires us to understand what's going on more comprehensively with families in a supportive way. So when I talk about targeted universalism, the purpose of this portion of the system, this platform, or number of platforms, would be to connect with all families, so that the message in Riverside County is, we care about every child who is born, and we want to make some amount of contact and say this child is welcome in this county, and this child is supported in whatever way, and this child's family is supported in whatever way is needed. Importantly, to assess family assets and needs, so that with our limited resources, we're making the smartest offers to the families who are going to need it the most, and who we're going to have the most impact in terms of preventing them from experiencing poor outcomes or experiencing systems that we don't want them to experience. Some of the progress we've made in this area is our Healthy Steps initiative. That's that sort of pediatric enhancement that I was talking about. It's a little more involved than I described it, but that's one way to provide that platform. High quality early learning is another way to provide a universal platform terms of universal offer and availability, family resource centers as a place that is welcome for all families to walk in. And some of the things that are going on in the environment around us are Cal-Aim Medi-Cal reform, which will potentially create new avenues to provide new avenues and new resources for providing these types of services to families. The challenge here is to establish clear fiscal incentives and accountability structures. So, for example, in the state of California, we have a program called Comprehensive Perinatal Services Program that is really meant to do a lot of this on behalf of pregnant women, but we don't have strong accountability structures. So one challenge we might have is to ourselves is to improve the accountability structure. And our opportunity when it comes to the universal platform is to embed universal platforms within the healthcare sector. It doesn't mean that they wouldn't, that wouldn't still exist in early learning, family resource centers, but right now there's a particular opportunity for building out universal platforms within the healthcare sector. Moderate need, and these percentages, they are just estimates. They're estimates based on diverse counties. It's not specific to any one county, but that in general, this 40% of the population can kind of be estimated to best benefit from a universal touch, 35 to a moderate connection. And so what's the purpose at this level? The purpose is to engage families. You want to actively be engaged. It's not sort of a, okay, we checked in with you. You seem to have all your needs met. We're here if anything changes, which would be that bottom. But this say we're going to continue to engage because we recognize that there are challenges that I kind of call this like the families that are on the fault line, where their family functioning is positive for perhaps, but one person loses their job and they're really at a high risk of not being able to meet some of their basic needs and the various challenges that will create for them as a family. So basically these risks start to become challenges in their lives. Some of the progress we've made in this area is we have invested in moderate intensity home visiting, which is a good offer to make to a family who might just be having some initial struggles. Our Help Me Grow system, this is where, particularly you can see the interrelationship of the various domains of development of a child. If a child is having basic need challenges, there's very likely going to be a developmental delay. So knowing that at this level, we have the Help Me Grow, if something arises developmentally, that we have a Help Me Grow system, which helps families navigate services for mild to moderate delays. So these are families that are not where the delay or disability is not eligible for the regional center. And that would include, we know that there's already a policy change that's intended through Cal-Aim to allow for more availability of early childhood and dyadic behavioral health, which was held up by issues of eligibility. And some of those eligibility barriers are expected to be removed. Our challenge in this area is to normalize the utilization of family connection to social support. So families may, as we all have recognized, start to feel like, I know I need help, but I have this idea about what it says about me, and to sort of normalize everybody needs support at some point. And that's a challenge in this area, as the families begin to feel a little bit more like they're being targeted while they recognize they actually would benefit and are interested in support. And our opportunity is that everything we do with families that we see in this category, that we make primary prevention family-centered and strength-based. This is the most important, it's foundational to the whole system really, but to make sure that families understand that support comes from a place of seeing a family's strengths and recognizing that they know best what's for their family, and that we are here to support their vision for their family. And finally, the high need population, which can be estimated to be around 25%. And the purpose of this platform or set of platforms in a targeted universal system are to promote parenting skills in the context of the family challenges. At this point, we would assume families are experiencing significant challenge, and that our support would continue to be for everything that is their intent for their family, but just in context of the challenge. It doesn't change that we're still talking about strengths. It's just that the challenges the family are experiencing at this point are now context that need to be taken into account so they can continue on with the same outcome expectancy that we have for all children. And it requires more ongoing assessment and responsiveness, more navigation and connection to resources. So a sort of greater level of engagement. So some of the progress we've made in this area is we've also invested in more intensive home visiting programs, which are not only programs that have been researched, that are research-based related to preventing abuse and neglect. Home visiting programs are also the top referral nationwide for children with mild to moderate delays. So there's more than one reason to refer a family to an intensive home visiting program or even a moderate home visiting program. And that there is more going on at the state and federal level around incentivizing prevention. So it's, that's progress in this area. Our challenge is to maintain engagement with families through the challenges that they're facing, and effectively supporting their needs as they are evolving. And finally, our opportunity is to integrate intensive parenting support systems into child and family safety net systems. So there's a couple ways to look at that. One, just so that the safety net systems know, they may be addressing a particular challenge for a family is having, and not feel like they're necessarily the expert or have the resources needed around something that's parenting related, that there's strong integration so that those safety net systems know who's providing these preventive services and how they can best tap into those. The other is to learn about how often preventive services are what we call covered benefits within a particular sector, within child welfare, within the healthcare sector, and making sure we know about those and we capitalize on those, making sure that if that's something that's already funded, it's saying, hey, this is a family that's being served in X program, this home visiting program, but they are eligible for behavioral health services, and we're going to make sure that they get those. So, whether those behavioral health services are from a very early prevention versus, ongoing deep support. So with that, I will stop there and tell you that is the vision we would like to move towards by learning from what we have funded and what we have worked on and our projects and programs over the years. I would like to see a robust system of prevention with platforms that touch families' lives naturally to support them. Thank you.
All right, Barbara, thank you. Thank you so much. I just know in my personal experience in working with First Five and referring clients to First Five, your services are always top notch. You guys have it together.
Thank you.
So you guys are always doing a really great job and are just super supportive to both service providers as well as, our families that we serve. So that concludes the day. Does anyone have any last minute questions for Barbara? I know it starts getting a little tougher towards lunchtime. All right. Oh, that's right. Okay. So Noemi wanted me to remind if anyone is looking, seeking to get professional growth hours, we will be providing that for this training. For those people that logged out, we will be reaching out just in case they needed the growth hours. But at this time, thank you so much for your presentation. Thank you for taking the time out of your day to be a part of this. And like everyone else, we will give you the virtual round of applause. All right, so we have a lot of thank yous, great presentation, thank you. All right, so this concludes this year's virtual conference. Thank you all for joining us. And we hope you learned about all of the different services that continue to be occurring. So there is help out there. Please share this with your families. All right, goodbye, everyone.